Oh, we'll go over to the window. Yeah. Sorry, I'm trying to be a bad guy here. Do you want charts or do you want Fox News? Yeah, no, there's no third choice. We have the gavel. All right. The hearing will come to order. Before I start with my opening statement, I want to outline our plan for a hearing next week. As part of the House budget, we propose to replace the sequester with reforms that ensure that we get the deficit reduction we all want without the huge reductions on top of reductions that the Obama administration is already planning in the defense programs. So pursuant to the budget, we are going to consider reconciliation and other legislation to fix the sequester, as we discussed in our markup. As a result, I think we need to learn more about the sequester, how OMB would implement the sequester, and what the impact would be, and to learn about the specific proposal for replacing the sequester. To that end, we plan on holding a hearing on the Budget Control Act on April 25th. For the past couple of weeks, we've tried to get OMB to agree to testify. They have refused so far. We sent a letter to OMB yesterday to the acting director asking that they testify. My hope is that we can have a hearing next week. It's critical we fix this sequester and secure the deficit reduction called for in the Budget Control Act. And I just want to have members know this to mark their calendars for the hearing we're planning on having. Let me get in my, you want to speak on this?
Just very briefly,
Yeah.
Mr. Chairman, I just want to make the point, and I think the CBO has been clear on this, as has the White House. They have a plan for replacing the sequester. They have a budget that they presented to the United States Congress that would replace the $1.2 trillion in deficit reduction mandated by the sequester with a balanced approach. So they've been very clear and on the record through their budget as to how they would avoid the sequester in a way that maintains deficit reduction.
Right, but the question is, if no plan is passed to replace it, then how is it to be implemented? That's what we want to get at. So, before we start, let me note today that millions of workers and businesses are filing their taxes today. I view the core mission of this committee as ensuring that every dollar the government takes from hardworking citizens is spent as efficiently and as effectively as possible, and only on programs where the federal government has a critical role to play. To that end, the focus of today's hearing is on reforming the federal government's role in public assistance programs so that taxpayer dollars are carefully targeted to those in need, the disabled, the sick, and those who, through no fault of their own, have fallen on hard times. As we seek to end wasteful practices, promote independence, and protect the safety net from the threat of a debt crisis, we should learn the extraordinary successes of the 1996 Welfare Reform Act. There's a lot to be learned there. On the eve of the 1996 welfare reform, Democratic Senator Frank Lautenberg voiced his concern that the bill would transform America into a third world nation, leaving, quote, children hungry and homeless, begging for money, begging for food, and even at 8 and 9 years old engaging in prostitution, close quote. Senator Lautenberg was not alone in making these kinds of apocalyptic predictions about this historic law. But what happened in reality? Transforming welfare by, among other things, instituting meaningful work requirements, setting time limits, and empowering states to design more effective programs, just like we did in Wisconsin, cut caseloads in half against a backdrop of falling poverty rates. There was a single greatest reduction in poverty among children since the 1960s. Poverty among children in female-headed households fell from 55.4% in 1991 to 39.3% in 2001. The Congressional Research Service said this past December that, quote, since 1996 welfare reform, progress appears to have been largely sustained in both reducing welfare dependency and poverty among children and female-headed families in spite of the recent recession. Today, over 15 years later, we are hearing the same kinds of hysterical predictions from critics of our budget. Last week, President Obama accused Republicans of being, quote, social Darwinists. I didn't think that Senator Lautenberg's outlandish accusation could be topped, but I think it has been now. Let's put aside the outrageous rhetoric. Let's look at the facts. Let's look at what works and what doesn't work. Let's look at where we're headed. Let's look at what a debt crisis would do to us. Let's look at what the House budget actually does. This budget treats all Americans with respect and dignity. It recognizes that the federal government's attempts to help can often do more harm than good. What honest observer of government could not disagree with that? It is in our national interest to create a class of people permanently dependent on the government? No, it's not. More to the point, is it in the best interest of these individuals to become dependent upon government? No. We must also ask, what happens to those who are most in need of government assistance when the government can no longer pay its bills, if we have a debt crisis? We face the most predictable debt crisis in history. And if this crisis hits, those who rely on the safety net the most will be hurt the first and the worst. Just turn on the TV, look what's going on across the Atlantic. In contrast to the gradual reforms that our budget phases in, reforms that protect those most in need of help, a debt crisis would force sharp, immediate cuts in spending, hurting those who cannot help themselves. Meanwhile, sharp, immediate tax increases would stunt job growth and opportunity for those who can. We saw the success of welfare reform. Our budget follows the tradition of this success. Opponents of reform were wrong in 1996, as we believe they are today. As we act to prevent a debt crisis that truly would devastate the poor, they are even more wrong. I want to thank all the witnesses for coming today. I appreciate you taking time out of your busy schedule to provide us with your testimony. We've had people who have been involved in this issue for years and decades, who've done great scholarly work, and I welcome the insights that you're going to bring to this committee. And with that, I'd like to turn to the ranking member, Mr. Van Hollen.
Thank you, Mr. Chairman. I join the chairman in welcoming all of our witnesses today to a very important hearing. I think there's universal agreement that we should spend taxpayer money wisely. I also think there's agreement that we should learn from successful reforms. I think, as we'll find out in this hearing, some of the successes that apply to the welfare reform provision simply do not apply in this case, and we'll also hear some of the consequences of certain aspects of that reform. Mr. Chairman, there's a difference between reform and just taking a hatchet to important social safety net programs. We obviously have deep differences of opinion on this issue. I happen to think that the President's characterization of this budget is correct, and I think it's Orwellian to present a budget that tears a huge hole in the safety net as one that's in fact designed to strengthen support for vulnerable Americans. And this week brings a very strong contrast to the different approaches that would be taken in this body and in the Senate. We saw in the Senate yesterday a vote on the Buffett rule, asking millionaires to pay more to help reduce our deficit. Meanwhile, here in the House, we're having a vote this week on a bill that would add billions of dollars to the deficit by providing tax breaks to hedge fund owners, to Washington law firms, all under the guise of a small business bill. And here in the Budget Committee, we're talking about a quote, strengthening the social safety net, when in fact this budget tears big holes in it. Let's put this hearing in context and why we are here today. And it's because the budget that's been presented by our Republican colleagues takes a lopsided approach. It ignores the advice of bipartisan commissions that say that any credible, responsible approach to reducing the deficit combines cuts, and we need to make cuts and difficult decisions, but it combines those cuts with an end to special interest tax loopholes and asking folks at the very top to pay a little bit more to help reduce our deficit. And because it refuses to ask wealthier Americans to pay one penny toward deficit reduction, because it takes that whole revenue stream out of the equation, it means that their budget hits everyone and everything else harder. That's simple math. We've talked in this committee about the impact the Republican budget would have on the Medicare guarantee and ending the Medicare guarantee. We've talked about how it would cut very important investments necessary to keep our economy strong in our infrastructure and transportation, education. Today we'll focus on its impact on the social safety net. And I have to say that the storyline, at least part of the storyline that accompanies this Republican budget is, in my view, a cynical one. It is one designed to tell Americans that these social safety nets are not necessary because people choose these safety nets over getting a job, that people who are out of work choose to be out of work, that people who need the support of food and nutrition and health programs choose to be in that position, and that by cutting these essential supports, by making people who are on the economic edge even more desperate, that we will give them renewed willpower to pull themselves up by their bootstraps, that in fact we're doing a favor to the people who will be most harmed. As we consider how we can strengthen the social safety net, we should be clear about what our goals are and how we define success. Is our goal, in fact, to strengthen that social safety net? If that is the goal, Mr. Chairman, we join you in an effort to find essential reforms. But if our goal simply is to take a hatchet to part of the budget in order to meet certain targets while refusing to take a balanced approach, we cannot join in that effort. And what this does is cut Medicaid by $810 billion. By the year 2020, the Medicaid program would be reduced by a full third. By 2050, and these numbers are according to the Congressional Budget Office, it would cut Medicaid by a whopping 75%. It does this by converting Medicaid into a block grant program that provides inadequate funding that fails to keep pace with the need. It does this under the name of flexibility, refusing to recognize that Medicaid already has a lot of flexibility. More than 30 states already operate under the Medicaid waiver. CBO has concluded that this will mean states either have to pay a lot more, which means increased taxes on their citizens, or cut back significantly. An Urban Institute study recently explained what the consequences are. We'll have a conversation about to what extent the work incentives under Medicare, under welfare reform, actually apply to a program like Medicaid. I think we'll find that the comparison stops very early on. We'll also have a conversation about SNAP, the Food Assistance and Nutrition Program. It was decided back during welfare reform not to block grant that because it did provide an essential absolute safety net for people in need and provided an economic stabilizer. So, Mr. Chairman, again, I think that people are willing to explore ways that really reform the process for the better. What we're not willing to do is simply cut blindly programs that are absolutely necessary to provide help to people in need, including lots of seniors, simply to meet one half of a budget equation that refuses to look at the revenue half of that equation. And while cutting provides additional tax breaks to people who are the best off in this country. We don't think that's shared responsibility. We look forward to working with you on a deficit, on a budget plan, a deficit reduction plan that truly meets that goal. Thank you.
Thank you, gentlemen. Obviously, our goal is to bring spending that's sustainable and to include reforms that actually work to serve the purpose of these programs, which we think we've missed on that by virtue of just the results of the fact that poverty is at an all-time high. With that, we will start with Dr. Casey Mulligan, Professor of Economics at the University of Chicago. Welcome. I think it's your first time coming to the Hill. Then we'll go with Ron Haskins, Co-Director of the Center on Children and Families at the Brookings Institution. Ron's no stranger to this body, as is Dr. Robert Rector, Senior Research Fellow at the Heritage Foundation. And Bob, we've kept your seat warm. I think that's where you always sit. It's good to see you again. Bob Greenstein, President of the Center on Budget and Policy Priorities. Why don't we go with Casey, then Ron, then Robert, and then Bob. So Casey, go ahead. Dr. Mulligan. Sorry.
Chairman Ryan, Ranking Member Van Hollen, and members of the committee, thank you for the opportunity and honor to discuss with you today how new safety net program rules over the past couple of years have changed the reward to work. A multitude of public policies affect that reward and thereby affect who is employed. A basic economic principle is that the monetary reward to working has important effects on how many people are employed and how much they work. By definition, the monetary reward to working is the difference between the resources a person has available to use or save if she works and what she has available when she does not work. The effect of taxes and subsidies on the reward to working can be summarized as a marginal tax rate. By that I mean the difference between taxes paid net of subsidies received when working and net taxes paid when not working, sometimes expressed as a fraction of the amount produced when working. Now, people without jobs or otherwise with low incomes sometimes receive benefits from social safety net programs. The benefits are rarely called taxes by laymen, but economists understand the benefits to have many of the characteristics of marginal tax rates because a program beneficiary loses some or all of her benefits as a consequence of working. The more income that a person receives when not working, the less is the reward to working. A multitude of public policies affect the reward to working. To name just a few: federal, state, and local income taxes, payroll taxes, unemployment insurance benefits, and nutrition assistance programs. Thanks to a labyrinth of relevant programs, the marginal tax rate can equal or exceed 100% in some cases, which means that the reward to working is zero or negative. In such cases, a person might have more resources available to use or save as a consequence of working less. Legislation that supposedly cuts or credits taxes can nonetheless reduce the reward to working and increase the marginal tax rate appropriate for labor market analysis if it cuts taxes more for those who work less than it cuts taxes for those who work more. Even private sector transactions, such as the settlement of mortgage, consumer, and child support debts, sometimes may have many of the characteristics of taxes paid to the public treasury, especially in terms of their propensity to reduce the reward to working. The reward to working, and therefore the marginal tax rate, affects what people do. High marginal tax rates mean small incentives to seek, create, and retain jobs. The consequences of high marginal tax rates are felt all over the economy, even by persons whose individual marginal tax rates might not all be all that high. Now, America absolutely must have taxes and must have safety net programs, even though they reduce the reward to working. But if this Congress wants to understand or shape what is happening in the labor market or to the budgets of social programs, it would be counterproductive to approximate marginal tax rates as zero, or to assume them to be eternally constant regardless of what incentives are embodied in new legislation. In reality, at least a dozen new and important federal and state safety net benefit rules have collectively changed the reward to working, especially for groups whose employment rates are particularly sensitive to safety net benefits. Of course, unemployment insurance program benefits are now available longer into unemployment spells, up to 99 weeks, than they were 5 years ago. But also, don't forget that new modernization provisions now provide unemployment benefits in a variety of circumstances when benefits were formerly unavailable. While it lasted, the 2009 American Recovery and Reinvestment Act also added a bonus to weekly unemployment checks and helped unemployed people pay for their health insurance. The food stamp program expanded in a variety of dimensions. All of these policy changes and more serve to increase marginal tax rates over the past couple of years. By my calculations, the net effect of all of these changes through 2012 was to increase marginal tax rates for the median household head or spouse at least 4 percentage points above what they were in 2007. And this was on top of the 40+% marginal tax rate already in place back then. Marginal tax rates have increased even more for less skilled people. It is sometimes claimed, by non-economists at least, that the safety net does not prevent anyone from working because supposedly everyone strives to have more income rather than less and would gladly take any job that paid them more than the safety net did. This income maximization claim is contradicted by the most basic labor market observations, not to mention decades of labor market research. A presumably unintended consequence of the recent safety net expansions has been to reduce the reward to working and thereby keep employment rates low, keep unemployment rates high, and keep national spending low, longer than they would have if safety net program rules had remained unchanged. The bottom line is that helping the poor and economically vulnerable has a price in terms of labor market inefficiency. Since 2007, we have been paying more of that price. American public policies have moved significantly in the direction of less labor market efficiency and perhaps more than was necessary for providing the assistance to those who need it. Thank you.
Thank you. Mr. Haskins.
Chairman Ryan, Ranking Member Van Hollen, members of the committee, thank you for inviting me. It's a great honor to be here to testify. I think this is the only place in the country where there American people could come and see a budget that will actually seriously address our long-term deficit and bring it into acceptable range in the foreseeable future. So I think that's a great achievement. Of course, it doesn't mean it has to happen exactly the way Chairman Ryan lays it out, but I assume that this committee will have a full argument about how the Democrats would like to change it, and in the end, we're going to have to change a lot that we do, including, I think, both taxes and spending, and so have at it, and I'm glad to participate in it. I was asked by the committee to talk about three things: spending, phase-out rates or benefit reduction rates that Casey just talked about, and block grants. So let me just say a few words about each. First, on spending, Robert Rector has laid out the spending in great detail. I'm going to defer mostly to him, but I do want to make a few points. First, if you look at Figure 1 in my testimony, here you see that there has been a huge increase in spending on means-tested programs. These are the 10 biggest means-tested programs taken from a CRS document. So this is not the entire safety net. It's the 10 biggest programs. And it is increased every year, almost every year, both in constant dollars and in total spending and per person in poverty. So we're spending more and more and more. To give you an example, if you take 1980, we spent about $126 billion on these 10 programs. In 2011, we spent $626 billion on these programs. And if you translate that to spending per person in poverty, it goes from about $4,300 to $13,000. So no matter how you look at this, we have very substantially increased spending. By the way, it's also increased about 31% in the 3 years of the Obama administration, even though in 1 year and perhaps 2 years, spending per person in poverty actually fell. That shows you how much the poverty rate increased. So we have a lot of spending. I was on the committee of the Ways and Means, on the staff of the Ways and Means Committee in '96, and we thought we had a pretty good safety net, and we're spending about a third of what we spend now. So the point of this is that I think there ought to be savings in here, and it's a matter of looking to how to get it. So spending, big increases, no matter how you measure it. Some of the money is spent by people above the poverty line, and the big question is, what are the programs that we're getting the most benefit from, and what are the programs we aren't, because we need to change something. Some of the savings are going to have to come out of low-income programs, I believe. Second, phase-out rates. This is a huge problem. Casey's testimony is the best short treatment of this issue that I've ever seen. It's really complete. If you read the references, it'll drive you nuts because it's a very complex area. If you show the third figure here, skip that one and go to the next one. This shows a chart. I'm not going to explain the chart, but I just wanted you to see what you could nicely call a spaghetti chart. It's from the Congressional Research Service from 1995, and what it does is trace out what happens to various taxes and benefit programs as a person's earnings increase. This is exactly the topic that Casey was addressing. And as you can see there, you never get as much as you earn. That's the disincentive effect. And in some points in the distribution, you lose almost everything you earn. And at one point, you actually lose more than 100% of what you earn. It doesn't pay to earn that extra dollar. So these are a big issue in our programs, and they stem especially from the fact that we have so many programs in both the tax code and in spending programs, and it's hard to, some are going down and up, they're not coordinated at all. We could create one big program, but that would create all kinds of headaches, administrative and otherwise, that I outline in the testimony. So this is definitely a problem, but I want to point something out. In the welfare reform legislation of 1996, we basically cut through this problem by saying you have to work. Work requirements and time limits, saying also a time limit on welfare, they trump phase-out rates. Why? Because you have to work. And that's what the welfare reform bill did, and people went to work in droves. And secondly, we have created over the years what I would call a work support system that has earned income tax credit, child care, and other benefits that helps low-income working families. Back in the old days, if people took a job, they lost all their welfare benefits. So we've reduced those benefit reduction rates, but they're still very substantial, as Casey points out. But if you, in a program where you're required to work and lose your benefits if you don't, then I say the benefit reduction rate makes much less difference than under other circumstances. And finally, I want to say just a few words about block grants. Block grants have two huge advantages. One is, from the state perspective, they give a lot of flexibility. Now, not every block grant does that. You could write a block grant so it's full of all kinds of details and requirements, what governors used to call strings, in which case it doesn't give states the flexibility. The other advantage is, from the federal perspective, that it's a way to control spending. An open-ended entitlement like Medicare, Social Security, Medicaid, and so forth, you're subject to the whims of the population and what changes people make in benefits and so forth, and those programs don't come up for review very often. So a way to control the spending is to give a block grant with a fixed amount of money and give the states flexibility. I would make at least one exception to that, and that is, I think we still have to have accountability. We have to have financial accountability, which I think we would have almost no matter what you do because of the Single Audit Act. But we also have to find out if these programs actually have impacts. So I would require data reporting from the states to see if these programs are having their intended effects. Another thing I want to say about block grants is that when we passed two big block grants in '96, both the TANF program, which ended about 3 welfare programs and put them in a block grant, and a daycare program, block grant, which ended about 5 programs. And when we did that, we consulted carefully with the states. We had one consultation session, I remember, had 30 or 40 people from state governments in there, and we went through the changes that we were making in the strings that were on the block grants. Since the states have to implement them, I think it's a very good idea to consult carefully with the states in the construction of the block grant. So, Chairman Ryan, thank you again for asking me to testify. We simply have to do something about our deficit. Our children and grandchildren are paying the price, and it is going to involve some changes in low-income programs for sure. Thank you.
Thank you, Mr. Haskins. Mr. Rector.
Thank you very much for the opportunity to testify here today. I'm going to, if we were to look at the overall safety net, I think it basically has 3 components, which are for the elderly, Social Security and Medicare, for the unemployed, unemployment insurance, and workers' compensation, and for the poor, what I call the means-tested welfare state. Now, the means-tested welfare state is largely unknown. Everybody understands we spend a lot of money on Social Security and Medicare. Virtually no one understands that for every dollar we spend on Social Security and Medicare, we're spending 75 cents on assistance to the poor. And this year alone, that spending came to $927 billion, close to $1 trillion a year on expenditures that are largely unrecognized. Most of the debate about this system is irrational because there are 79 different programs, and when we talk about welfare, we basically talk about one program at a time while ignoring the other 78. It's like having a jigsaw puzzle with 78 pieces, but when you write a press story about it, you only write a press story about one piece at a time. That always makes the welfare state seem very small, very meager, and it always seems like we're not spending enough, basically because we're never actually discussing how much is going out the door on these programs. Now, if you take this $927 billion, these programs are unique in the sense that they have required state spending in them. So you can't just look at federal spending. You are requiring states to spend money on these programs, particularly Medicaid, and that goes out the door and assists poor people. And that's about a quarter of all this spending. You have to add that in order to get a good sense of the resources. When you look at these 79 programs, what you find is about half the spending goes to medical care, primarily through the Medicaid program. About 40% of it, which is about $380 billion a year, goes to cash, food, housing, and housing programs, lots of different programs there. And about 10% of this spending goes to what I call our enabling programs, programs that are intended to make the poor more self-sufficient, like child development or targeted job training or targeted education funds into poor communities from the federal government. About half these benefits go to disabled people, and about half of these benefits go to families with children, predominantly single-parent families with children. About a quarter of them go to the disabled. About 15% go to the elderly. So it's a diverse population. And Ron has gone into this spending. Adjusting for inflation, back when the war on poverty started in 1965, we were spending about, I think, $60 billion a year. This is spending, adjusting for inflation, has increased 16-fold since that time. Altogether, we have spent $19.8 trillion in means-tested assistance since the beginning of the war on poverty. People would say, oh, well, that's mainly in medical care. This breaks it out. The purple is the medical care, but you can see, even after adjusting for inflation, all the other types of spending went up very dramatically as well. For example, means-tested cash, food, and housing over the last 20 years actually grew faster than Social Security spending. Most people have no idea of this. In fact, a lot of people are surprised when they see this, and they say, I thought we ended this back in 1996. And I say, yeah, you ended it short of $927 billion, okay? Enormous growth in spending with really no stopping point. This chart shows this spending as a percentage of GDP, and what you can see is back at the beginning of the war on poverty, the spending was about 1% of GDP, and it increases about 1 percentage point of GDP each decade. By the 1980s, you were up to around 3.5% of GDP. During Bush's presidency, you were at about 5% of GDP. We've now ratcheted up to 6% of GDP. And people might say, well, that's reasonable. We're in a recession. We ought to spend more money on the poor during a recession. But when you look at Obama's out-year projections in his FY 2013 budget, this spending never comes back down. It grows dramatically over the next 10 years and will remain always at or above 6% of GDP for the foreseeable future. One of the rules here is the ratchet principle. When this spending goes up, there's never any press comment on it, okay? It's invisible, absolutely invisible. It just goes up, and you never will see a press story about this at all. Then after it goes up 1% of GDP, if you were to try to pull it back down to, say, 5% of GDP, oh, then you're savaging the safety net, and so forth and so on. So all the increases are always invisible. They're off camera. They're never talked about. If you try to take a dime out of this after it's been ratcheted up, oh, the sky is falling. The end of the world is right here upon us. Now, one question is, well, how much is this spending? How much is $927 billion a year? Well, the answer is if you just took that money and divided by the number of poor people in the U.S., it comes to around $19,000 per poor person per year. My figures are a little different than Dr. Haskins because I have the state contributions in this as well. And that's not a very accurate figure because a lot of this spending goes to non-poor people as well. So a more accurate way of assessing these resources is to say, well, if you took all of this spending and spread it out equally within the lowest income 1/3 of the population, about 100 million people, which is probably the pool of overall recipients, how much does that amount to? It comes to around $9,000 per person per year, or around $36,000 for a family of 4. One way to understand this, how much this is being spent, is if you took that $927 billion and you converted it all into cash and you handed it out, you would have enough money there to raise the income of every family in the United States to 200% of the poverty level. That's $44,000 a year. You could take every single low-income family and raise their income to a minimum of $44,000 a year and still have about $200 billion in spare change on the side. That's how much is being spent here, largely invisibly, largely without any acknowledgement. And when you try to talk about this, which is very important, you will immediately get caught in the briar's nest of trying to talk about one program at a time. Well, let's talk about WIC. Let's talk about Section 8 housing. The fact of the matter is that there's an enormous overlapping system of benefits with far more money going out the door than anyone knows. And I would say before we permanently ratchet this spending up from 5% to 6% of GDP, which is what Obama is asking for, we ought to figure out where that money goes. Because I don't know where this money goes, nor does anyone else in this city. It goes out the door, but when you go to try to count it in the census and so forth, most of it disappears. You guys are stuck with the game, and the game, I call it, that's been going on in this city for 40 years is you spend it, and we in the welfare industry won't count it. All of our surveys and so forth, we will hide. We will not count this money as received by the poor. In fact, out of this $900 billion in spending, only about 4% of this is routinely counted as income received by poor people. And then we say, oh my goodness, poor people don't have any economic resources. You need to spend more money. It's a permanent con game on the American taxpayer. You have to have an honest accounting of how much money is going out the door. This is important spending. It does go, it does help people, but you have to have a real accurate depiction, understanding of how much you in fact are asking the taxpayers to pay in support. Now, people would say under the Obama administration, this spending has been ratcheted up by 30% in 3 years. It's the largest increase ever in the U.S. welfare system, a huge, huge increase. And most people, when I talk to the press or to just ordinary people, will say, well, that sort of makes sense, okay? We're in the middle of a very severe recession. We need more spending. But the anticipation is that that spending will go back down after the recession ends. No way. You haven't been in Washington very long if you think that's what's going to happen, okay? If you looked at that earlier chart and the one that Dr. Haskins had, this spending never goes down, okay? Maybe 3 years out of 50 years does this spending ever go down. And if you look at Obama's 2013 budget, what he shows is that this spending pauses for 1 year, and then it starts to grow and grow and grow and grow very rapidly. It never goes back down. It will always remain above 6% of GDP. And by 2021, you're going to be spending $1.5 trillion on means-tested welfare. And again, don't ever expect to see any mainstream news story on this. As this spending goes up year after year after year, the stories you will get is about some marginal cut in one of the programs or something like that, because basically the left does not want to acknowledge how much we currently redistribute income. Not to say that these programs should be just slashed or abolished or that they don't help people, they do, but we have to be honest about the magnitude of help that we're giving and try to design these programs more accurately. One other thing that's very important, I think, in the Obama budget is to look at the relative priorities given to the means-tested welfare system and national defense. This is out years. The blue line is that welfare or is national defense? The blue line in the Obama budget, that's national defense spending. The pink line is means-tested welfare. And what you find historically is in the entire post-war period, defense spending always greatly outstripped welfare spending. And that was true up until 1993, which was the first year that welfare actually jumped above defense spending. But from 1993 through about 2000, well, through the present time really, we've spent about $1.33 in welfare for every dollar that we were spending on national defense. Not exactly a story you see in the press either, but that's, the Obama budget breaks that entirely. And what Obama is saying is he's going to freeze national defense spending in nominal terms for a decade, while he's going to increase means-tested welfare by about 70% during that same period. So that while the current ratio of means-tested welfare to defense is about $1.30 to $1, Obama by 2021 is going to take that up to around $2.40 of welfare for every dollar spent on national defense. A huge transformation in national priorities and national programming. I think that it's clear that the deficits that are in the Obama budget are unsustainable, and to a significant degree, although not entirely, those deficits are the result of these very rapid planned increases in the welfare state that are buried in that budget. I think that what we need to do, among other things, is begin to get this welfare spending under control, not by severely cutting it, but by rolling the spending back to the levels that existed before the beginning of the current recession, adjusting for inflation, and then allow that spending to increase at the rate of inflation for the next 10 years. Reasonable, we were already at record levels of spending in 2007 before the recession began. If this spending is a temporary response to the recession, then instead of a permanent increase in the welfare state, we ought to be able to go back to those levels. If we did that, the savings for the federal government would be $2.7 trillion over the next decade. That's how large this expenditure system is. Again, I'm not calling for massive cuts. I'm calling for going back to the sort of system that we had before the planned expansions that Obama is seeking to put into the welfare system. Thank you.
Thank you. Bob.
Thank you, Mr. Chairman, for the opportunity to discuss these important issues. The leading research suggests that the safety net is actually functioning much better than is often recognized. Recently, a comprehensive review was conducted by some of the leading scholars in the field on the impact of the safety net. Among other things, they looked at the impact of the safety net on the amount that people work and found that the impact was quite small, and that after taking this behavioral effect into account, that the safety net cuts poverty about in half. They found that 1 of every 7 Americans would be poor without the safety net, but is lifted above the safety net by it. Now, as we're hearing in this hearing and elsewhere, questions are raised about the safety net's impact on dependency on the budget, and there's also issues about its impact on deep poverty. Let me briefly cover each of those in turn. Over the past few decades, we have moved, as Ron Haskins indicated, very much toward a work-based safety net. Cash welfare assistance for families who don't work has diminished greatly. Support for the working poor has increased. The results are notable. Even though 2010 was a year with an unemployment rate of 9.6%, and could I have the first slide, please? In 2010, 91% of all spending on federal entitlement benefits went to people who either aren't expected to work because they're elderly or disabled, or were members of households that did work. These data are consistent with the findings of the comprehensive review of the research I mentioned, which finds that today's much more work-based safety net doesn't have a large effect in reducing work effort. The study reported, for example, that the research shows the effect of SNAPs, formerly called food stamps, on work is quite, quote, small, and that the impact of Medicaid on work appears to be minimal. This is in significant part a result of major changes in both programs, from programs where you largely had to be on welfare to get the assistance, to programs primarily for low-income working families who are not on welfare, and where you don't have to be on welfare and can work at low wages and continue to get this support. The findings on these programs differ significantly from the findings regarding the effect of the old welfare system on work prior to welfare reform. Concerns that the current safety net is leading millions to become dependent and cease working are simply not consistent with the research. Let me turn to the budgetary issue, which the previous 2 members of the panel have talked a lot about. Now, we all know that Medicaid is projected, has been rising substantially in cost, and is projected to rise further. Healthcare costs are rising faster than GDP throughout the entire healthcare system. Private sector, Medicare, and Medicaid, they have been for several decades, and those system-wide cost increases raise Medicaid costs with them, even though Medicaid costs less per beneficiary than private insurance. Medicaid pays providers less. Medicaid costs also will rise further in coming years because of the aging of the population. Older people have much higher average health care costs than younger people do. And costs will rise also because of the coverage expansions in the Affordable Care Act. They don't add to the deficit in that their costs were offset by reductions in Medicare and increases in revenue, but they push up costs for means-tested programs. Now, here's the key point. The figures that Ron Haskins and Robert Rector have just presented of a safety net exploding in cost are dominated by healthcare. They are largely a story of healthcare. Let's look at the data. What I suggest is for us to really dig in and understand what's going on, that we take means-tested programs and we divide them into two categories, healthcare and all of the rest. When we do that, here's what we find. Next slide, please. We find that federal expenditures for all means-tested entitlements outside healthcare equaled 2% of GDP in 2011, and to be sure, that is 50% higher than the average for the previous 40 years. However, the recent increases are largely driven by the economic downturn and temporary program expansions under the Recovery Act. The CBO projections show that expenditures for means-tested entitlements outside healthcare will decline as the economy recovers. They will fall to 1.3% of GDP, these are CBO's figures, by 2020 and thereafter. In other words, by 2020, total means-tested entitlement expenditures outside healthcare will return all of the way to their prior 40-year average, the average for 1972 to 2011, and those figures don't include discretionary programs. Low-income discretionary programs are going to shrink because all non-defense discretionary shrinks under the Budget Control Act caps. Even if there isn't a sequester, it falls by 2021 to its lowest share of GDP since 1962. So total means-tested spending outside of healthcare is on track under the CBO figures to actually fall over the coming decade below its previous 40-year average. What about Robert's figures on the Obama budget about how much means-tested spending goes up in coming years? That is an artifact of the expansions in the Affordable Care Act. Again, let's look at health care and the others separately. I'd also note that when you look at how much the money is per poor person, you have to keep in account that over 2/3 of all Medicaid spending is for the elderly and disabled. Half of all nursing home expenditures in this country are paid for through Medicaid. You can't take the big nursing home expenditures per person and somehow hand that as a per cash amount to a low-income family with children. Final issue, deep poverty. So this is a matter of concern. The number of children living below half the poverty line increased by 650,000 between 1995 and 2005, even before the economy turned down, and these figures do count non-cash benefits like food stamps and housing and so forth, and the earned income credit as income. So basically what's happened is the changes wrought by the 1996 welfare law in combinations with expansions in the earned income credit have pulled more single mother families into the labor market and raised many of their incomes. At the same time, the welfare changes also deepened poverty among another group of single mother families, primarily those with less education and skills and more physical, mental health, or other problems. Some of those families fell deeper into poverty as a result of having little or nothing from either earnings or cash assistance. Basically, any intervention in any field of government or even healthcare, whatever, can hurt some people, help some people, and hurt others. The evidence suggests that the changes under the welfare law did reduce the number of people below 100% of poverty, and at the same time increased the number of people below 50% of poverty. This phenomenon is reflected in a recent study, next slide please, just came out about a month ago by leading researchers that finds that the number of families and the number of children living below a standard that the World Bank uses to measure serious poverty in third world countries, living on less than $2 per person per day, has doubled since 1995. These findings are of particular concern in light of emerging research, which shows that among low-income families, the level of income when a child is young affects school achievement and may well affect later employment and earnings as an adult. I would note here in this vein that were it not for the SNAP program, the rise in deep poverty would be much greater. The data show that SNAP cuts nearly in half the percentage of children living below that World Bank poverty standard and plays a very important role here. So in conclusion, one thing all panel members agree on is that we're on an unsustainable fiscal course. But we also have levels of poverty and inequality that are higher than those in most Western nations. The Bowles-Simpson Commission report sought to balance both of those concerns. It adopted and emphasized as one of its core principles that deficit reduction should not increase poverty or harm the disadvantaged, and it did not call for reductions in any low-income programs outside Medicaid. Last year, a group of Christian leaders ranging from the Catholic Bishops' Conference and the Episcopal Church to the Salvation Army and the National Association of Evangelicals issued a call for policymakers to safeguard the poor in deficit reduction and draw a circle of protection, their words, around programs targeted on them. So I would urge policymakers to seriously consider those principles as they face the tough decisions ahead. Thank you again for the opportunity to testify.
Thank you, Bob. Let me just begin with you, Dr. Mulligan. 1 in 6 people are in poverty today. Our rates are the highest they've been in a generation. And as we've seen, our spending on these programs is at an all-time high as well. So it's not working. That's the whole point here. What can we do to have our anti-poverty programs work? And that's the goal of this. And so I think this study in marginal tax rates, the implicit incentive or disincentive to move on to a life of independence, on to upward mobility, is something that we need to look at. You've done so much work on this, Dr. Mulligan. Could you bring up chart 8? We have Gene Sterling, his chart. You may be familiar with this at the Urban Institute, who talked about the implicit marginal tax rate is as high as 80% or higher between the income thresholds of $15,000 and $40,000. You mentioned what you have, the effect this has on labor force participation. 2 quick questions. What is the effect in your quantitative analysis on its effect on labor force participation? And what was the implicit rate before the recession, and what do you think it is now? And then on to that, I think you've done some research into how much increasing spending on the safety net was due to natural increases related to the recession, and how much was due to changes in eligibility and benefits. So where were we before the recession started with the sense of spending and the implicit marginal tax rate? Where are we now with respect to the marginal tax rate, and how much of the additional spending was because of eligibility or because of the recession?
Okay, Mr. Chairman, you pointed us to the chart here from, looks like from the Urban Institute, and that's showing something like a marginal tax rate as a function of income. It's at a certain point in time. I don't know what year is covered here. Maybe it's 2011 or something. But the point is that we're comparing different income groups, and you can see the line wiggles. There's not one marginal tax rate, of course. My work has really focused on not comparing the income groups, but comparing different years. Last year compared to 2007, before there was a recession. And in doing so, of course, I look at charts like this, but I like to summarize things in terms of kind of just a middle person. I called it in my testimony the median household head or spouse. What does their marginal tax rate look like? In 2007, their marginal tax rate from all these programs considered, as well as some others that aren't considered there, was in the 40s, the low 40s. Let's call it 42% for a precise number. And when the ARRA was at its heyday, that marginal tax rate went up around 50%. So it went up about 8 points, maybe 9 points. Some of those provisions expired, and now we're down to maybe 46%. So there was an increase at one point of 8 or 9%. Now we're just 4% or so higher. I say just. 4% is very big by historical standards. It's not like the marginal tax rate for the median household head or spouse changes every month or changes every year. That is a big change. You know, I like to use the analogy of, think of a fish tank, a 100-gallon fish tank, and it's full of water. and there's fish living in there and swimming around and having fun and stuff, and you ask me, well, what if I take a gallon of water out of that fish tank? And I say, well, the tank's already full. It's probably not going to be a big deal. There might be one sensitive fish there who's bothered, but most of the fish will be fine. But if you've got a fish tank that's half full or half empty because somebody else took 50 gallons out of it, and now you ask me, can I take a gallon out of that tank? I say, you better be careful. You're going to do a lot more damage to those fish when you take 1% of the tank's capacity out of a tank that's already half empty. And that's where we were in 2007, that people were not quite at 50%, but their marginal tax rates were up there around 40 or 50%. And what we did is we added several more percentage points to that. And that affects the economy. I don't claim by any means that everyone or most people stop working because the marginal tax rate goes from 42 to 46. I'm not claiming that. But we have decades of research on those effects. And what I found is that, you know, in reality, work hours per capita fell about 10% during the recession. Now they rebound a little bit. Maybe they're down about 8%. If we had just kept the safety net rules and the marginal tax rates the way they were in 2007, if we just kept it that way, the recession would have been kind of half as deep. Hours per capita would have fallen half as much. Employment per capita would have fallen half as much. Now, if you look at any single provision, as Ron was saying, you look at any single provision, you might say, well, what effect can that have on the employment rate? What effect can that have on unemployment rate? Well, yeah, there's just one provision, and it's small, but we have a safety net with many, many, many provisions. In my testimony, I list at least a dozen changes in the rules. When you add those changes together, that's what's having a sizable impact on the employment rate. So to put it simply, the safety net rule changes roughly doubled the magnitude of the recession. If you measure the magnitude of the recession in terms of either employment per capita or work hours per capita. The other question you asked, Mr. Chairman, was about the effects of the rule changes on the government spending as opposed to the economy. And Dr. Greenstein said that the growth in spending over these last couple of years is some combination of the recession and legislation. And I agree with that, but I understand your question, Mr. Chairman, to be, what's the breakdown?
Yeah.
How much is coming from the recession versus the legislation? Now, I've prepared estimates of spending, causes of spending changes on non-elderly people. So let's put a lot of the safety net spendings on elderly people. Let me put that to the side for a second. Even if we ignore what I just said, that the social programs themselves affected the economy, let's ignore that. The new eligibility and benefit rules added many more dollars to safety net spending than the recession did. Take, for example, the combined inflation-adjusted spending on unemployment insurance and SNAP adjusted for population growth. That spending would have increased about 40% if the program rules had been constant, thanks to the recession. And 40% is historically unprecedented. That's a big change. It would have changed 40%. But what happened in reality, we had, on top of the recession, we had program rules and program rule changes, and those two programs combined, their spending increased almost 200%. So the breakdown, Mr. Chairman, is 40 percentage points from the recession, another 160 percentage points from rule changes.
In UI and SNAP.
And UI and SNAP combined. And those are the source of, in the non-elderly safety net spending, that's over 3/4 of the growth in the safety net spending over the past couple of years has been those two programs. So I don't have a breakdown for you on the other programs, but you could see we got a big piece of the pie already. Now, I put elderly to the side. Elderly, spending on the elderly and the programs for the elderly, that's an important and an interesting topic.
Let me get you there, because I'm trying to keep Chris and myself to a time limit so we can get to other members, because I wanted to get to some of these other gentlemen, if you don't mind. Let me just ask you quick, Ron, you were deeply involved in 96 reform, so were you, Robert. Knowing what you now know from that experience, what would you do now in a very brief time period to do, say, welfare reform round 2 to try and replicate the sort of successes we saw in the late 90s?
I think that the biggest mistake in the legislation is, and I don't think anybody anticipated exactly how this was going to unfold, but there is a problem, I think, at the bottom. Robert and I disagree about this. I've had a recent exchange.
Deep poverty you're talking about.
Well, yes, measured in various ways.
Yeah.
So we have a lot of people at the bottom. I think they're incompetent. I don't think they're capable of holding down even a minimum wage job. They get a job, they lose it. They just cannot sustain themselves in the market. And they are the ones that are worse off. I think that problem is undeniable. Other people deny it and say that's not a big deal. Now, what would we do about it? We don't really know. And when I testified for the Budget Committee a couple of years ago, I said I wish we would figure out, we should do experiments to find out and try different things. I'm not talking about a lot of money here. I'm talking about trying to figure out how we can help these people at the bottom. Here's the point. More than in the past, our safety net is not just giving stuff away. It's requiring work. And I'm sure at least 1.5 million low-income mothers went to work as a result of welfare reform, and they're better off. Poverty fell, it turned out, as Republicans said it would. But this group at the bottom, they at least appear to be incapable of sustaining employment. So they are really in trouble. They get food stamps, they live with other people, but their poverty rates are extremely high and they last longer than in the past. So that's the group that I'm concerned about. But the rest of it, I think, is a good model for the kind of things that you want to do. I think block grants definitely should be on the table. I'm sure we'd have big arguments about exactly what the characteristics are and what the strings would be for the states. Here's one notable difference, though, just to take 1 second to say this, and that is in 1996, both Democratic and Republican state governors supported block grant. They wanted a block grant, and we negotiated with them and so forth. I'm not sure that's true now, and I'm quite certain would not be true about Medicaid. The governors would be opponents, at least Democratic governors, and I think some Republican governors too. That's a big difference between now and then.
I thank you. I want to keep time sensitive. The other two gentlemen will just get you in on some other questions from the other members. Mr. Van Hollen.
Thank you, Mr. Chairman. First, I would observe that while spending on safety net programs is high now, it is largely the function of the economic downturn. It's been called the second, close to the most serious downturn since the Great Depression, and that obviously has an impact on safety net programs. In fact, they're designed to help cushion people during especially different economic times. And so while spending is up, the poverty levels would be much higher in the absence of those programs. And a little later, I'm going to ask Mr. Greenstein to comment on that. Mr. Haskins, as you said, these safety net programs are requiring work now more than they did in the past. I assume, based on your involvement, you think that the EITC, the Earned Income Tax Credit, is an important part of the reforms that have been made.
Yes.
Right. Mr. Rector, you pointed to the fact there are 79 programs. There's no doubt that there are lots of programs, and I think we would all agree that we can look to see whether we can better coordinate programs, and where we can find efficiencies, we should. But I think you know that the big drivers of costs are really about 5 programs that really drive those. I assume one of the ones you're talking about on your list is as means-tested programs is the EITC. Is that not right?
Yes.
Okay. Mr. Mulligan, I just wanted to ask you about your analysis, because you state here, and I appreciate it. Obviously, anytime you have these kind of programs, it will have some impact on labor market efficiency. That's not the argument here. The argument is the magnitude and the extent. Here you say America absolutely must have taxes and safety net programs, even though they reduce the reward to working. And so there's no doubt at the margins here these things have impact. The issue is how much. Mr. Greenstein referenced another study that's been done, and I would just like, Mr. Chairman, to include it in the record. Okay. It was revised in June 2011 by 3 very distinguished economists, where they found that, taking into account all the behavioral effects in response to these incentives, has very little impact on the incentive to work. And I would just ask you, Mr. Mulligan, I understand that you recognize that some of the ARA provisions are expiring. Others are also going to expire in time. For example, under SNAP, there's a November 2013 end to the enhanced benefit. have you broken out the different components of that as part of your analysis with respect to the 4%?
Yes, I have done some breakdowns. It wasn't so much a breakout, it was a build-up. I built up all the programs together. And yes, there is an expiration coming on some of these things. On the other hand, we have the Patient Protection Act that is going to bring in some increases in marginal tax rate. And so on the whole, going out 4 or 5 years, it looks like marginal tax rates will continue to be elevated above 2007 levels.
Right. So I'm glad you brought up the Patient Protection Act, because it goes to Mr. Greenstein's point that really to have a conversation about this that sheds more light than noise, we need to separate means-tested programs into health programs and everything else. And if you could put up the next slide, please. This is based on Congressional Budget Office data. And this is based on current law. CBO looks at current law, so Mr. Mulligan, they look at the expiration dates for different enhancements in ARA, for example. And what this shows, the bottom line, shows all the major non-health related means-tested anti-poverty efforts, safety net efforts. And what you see is obviously they increased as the economy hit the skids, more people out of work. That's the bump up. And over time, as those provisions phase out and the economy improves, you'll see that that bottom line, the purple line, actually returns down by the year 2022 to 1% of GDP, in fact, lower than it was in the pre-recession period of time. The top line are the healthcare spending. So that includes Medicaid, that includes CHIP program, the Children's Health Insurance Program. It also includes the additional people who will be eligible for Medicaid as a result of the Affordable Care Act. So this chart, I think, is very important as we have this conversation, as Mr. Greenstein pointed out, because when you're talking about Medicaid, let's put aside the Patient Protection Act, when you talk about the current Medicaid program, the question I have for you, Mr. Mulligan, is if you agree with the statement made in the study that I cited, and here's what they say. They say that they find that when it comes to labor supply effects, the effects from Medicaid appear to be minimal, and they make no adjustment. Have you done an analysis of the labor supply effects of the Medicaid program?
Yes, in fact, my estimates are built on a lot of the work that Dr. Moffitt in that study has done. I was more ambitious. I look at a lot more programs that's included in their study. Unemployment insurance would be an important thing. Payroll taxes.
No, I'm just asking right now, with respect to Medicaid, if there was the Medicaid program, the effect of the access and ability of people to access that program on incentives to work.
In what year?
This year and going forward.
Yes, I have looked at that, and I agree with your characterization that by itself, it's small.
Okay. Now, the reason I raise that is this is the Budget Committee, right? We're looking at ways to reduce the deficit, I believe. We have a joint effort to do that. If you look at their budget, they cut $800 billion out of Medicaid over 10 years. And I just want to go to the next chart that shows what the composition of people on Medicaid is by dollar. These are the costs for Medicaid. Almost 2/3 of Medicaid dollars go to seniors and individuals with disability. I would venture to guess you're not going to get a lot of work incentive changes out of seniors in nursing homes. Another 20% benefits kids. I venture we're not talking about trying to put kids to work. So if you look at the big cost drivers and you look at the Republican budget, where they go is after Medicaid. And as you've said, Mr. Mulligan, the impact on Medicaid, the impact of Medicaid has on incentives to work is minimal, and we can see one of the reasons why, at least on a cost basis. So let's be serious about this conversation here in the Budget Committee. We're happy to look at reforming programs. As I said, there may be 79 programs. A lot of them are very small, and if we can find savings, we should. But the Republican budget reduces the Medicaid spending by 30% in the year 2022 and 75% in the year 2050. That's CBO, Congressional Budget Office numbers. And I think we should keep our eye on the ball here in that conversation. And I would just like to end by asking Mr. Greenstein to comment on that, because every member of this committee knows Medicaid is already stretched to the limit. And everybody talks about the provider cuts under Medicare. We already know that there are really tight provider expenditures in Medicaid. You have a waiver system that allows states great flexibility right now. And so to suggest that as part of this analysis and work incentives that we're going to get a lot of budget savings in the number one driver, Medicaid, is just wrong. Mr. Greenstein, if you could just comment on that.
Two comments. Interestingly, some of the studies that Dr. Mulligan cites in his testimony, when you look at them, what they find is, and this is something, an expansion in a safety net program, depending on how it's designed, can actually increase work incentives. Example, one of the studies he cites, issued by a conservative think tank here in Washington, found that the changes in Medicaid, which were bipartisan in the 80s and early 90s, that changed Medicaid so that children didn't have to be in welfare families to get Medicaid, and the children in working families, low-income working families, became eligible. It found that increased work incentives decreased welfare use. When you make it so that you have to be on welfare and can't work to get benefits, you're going to have big work disincentive effects. When you change the program so you can work and get them, and as the welfare law does, it's hard to not work and get cash assistance, then you can actually increase work incentives. I would argue that the Affordable Care Act is likely to increase work incentives. Little example. Today under Medicaid in the median state, if you're a low-income working family, you as a parent lose eligibility for Medicaid when your earnings hit 63% of the poverty line. If you're at 75%, if you're a full-time minimum wage worker, and I would note that 55% of all employees in the United States whose families are below the poverty line do not have an offer of coverage from their employer. If you are making minimum wage and you don't have an employer offer of coverage and you get really sick, you often have to quit your job in order to qualify for Medicaid. That's crazy, and the Affordable Care Act fixes that. With regard to the proposal in the House budget, my concern is that Medicaid already pays about 20% less per beneficiary than private insurance. It pays providers a lot less. And its costs are actually been rising a little slower than private insurance. And most states already contract with private managed care companies to run the Medicaid program for children and parents. It's extremely difficult to see how you could get savings of the magnitude in the House budget without really deep cuts. And the Urban Institute studied this last year, and under their most optimistic scenario, in which states succeeded in doing efficiencies that reduced Medicaid cost growth per beneficiary all the way to GDP plus 0, they found that states would have to take 14 million low-income people off of Medicaid to fit within the budget parameters, and if they weren't as successful, it could be as much as 27 million people losing Medicaid coverage, with an average reduction in provider rates of about 30% on top of that, meaning there being few doctors to accept patients.
Thank you. Mr. Garrett.
And I yield the first 30 seconds to the Chairman.
Yeah, I just want to point for clarification. I think it's been said a couple of times. Our budget does not propose on Medicaid work requirements or time limits. That's not a proposal contained in our budget. So I just want to clarify that. The other point is, our budget, we're spending $100 billion next year on Medicaid alone. So I know this is the Washington talk. It's not being cut. It's not growing as fast as what the president's budget proposes. And yes, we do propose to repeal the president's health care law, which has a dramatic increase, but we're actually still increasing spending on Medicaid in our budget. We're not calling for work requirements and time limits on Medicaid, and that is now defined as a savage cut when it's actually an increase that is not as big of an increase as the president's proposing. Mr. Garrett.
Thanks. Mr. Rector, according to your work, as we've heard already, there are 79 means-tested welfare anti-poverty programs that the federal government runs at a cost around $927 billion per year. And since the creation of the modern-day welfare state back in the 60s, the size and scope of these federal anti-programs have skyrocketed. In fact, according to CRS, taxpayers spent $2.7 billion in today's dollars back in '62. Today we spend around $600 billion on the welfare programs. All these are well-intentioned or well-motivated in safety net programs, but I'm concerned that many of these programs are unconstitutional. You have TRIO, you have Job Corps, you have energy programs like LIHEAP. There are just a few of them that have dubious constitutionality, I would think, and are better off, quite honestly, left to the states to do. Now, this issue of constitutionality is a timely one, considering what's going on across the street, or has gone on across the street with regard to health care. But most of today's so-called welfare state is built on what I would suggest is an unconstitutional foundation that we should begin to examine closely. So the question to you is, out of these 79 welfare programs are out there, how many do you think, or what percentage, are simply totally unconstitutional or highly questionable in their constitutionality?
I would agree with you that it's very difficult to find a constitutional basis for much of any of this, but I'm a realist, and these programs are not going away. And the reality is, I think we would have been better served if the state governments had taken the role here, but all the way back into the 1920s, the state governments have been shucking their role, and basically their role, their main function is to come here and ask you for more money. Honestly, I've been doing this for 30 years. That's basically what I see states do. I do think that what we have to do is change the nature of the programs. And one thing that we need to avoid is the idea that the solution to this is to collect money in Washington and then hand it over to the states willy-nilly without any goals or guidelines, and that's a recipe for success. In fact, that's a recipe for failure. The word block grant is frequently used with respect to TANF. I would say that's a misnomer with respect to the Temporary Assistance to Needy Families program, which I helped to design. I would call that a work activation grant, because the core of that program was to push people off of welfare and into employment, and it was within its own little limited realm, which is a very small portion of the welfare state. It was pretty successful in doing that. But we didn't say that the idea was to collect money here in Washington and then hand it over to the states. The biggest block grant program of all time was revenue sharing, created by Richard Nixon. What was the first program that Ronald Reagan abolished when he got in office? Revenue sharing. It was a waste of money. I would love it if the states wanted to take fiscal responsibility for this, but I don't see that. And so what you have to do is try to deal with this real world, which is a huge system that's growing very rapidly, a system that penalizes work and penalizes marriage, and thereby generates an endless increase in need for aid.
Well, let's just follow up on that then. To your left, Mr. Greenstein was just making reference to how some of that is potentially addressed in the Affordable Health Care Act, in his argument, that when you get into the situation of marginal tax rates and that there's a benefit of actually staying on the system as opposed to actually getting out and getting the work. Do you agree with the assertions that you just made? He sounded reasonable.
I think that that's a fool's errand, and it'll end up costing you more.
Why is that?
If you try to reduce these marginal tax rates, you just expend the programs farther and farther up the stream until you have these programs going up to families making $80,000 a year. Way back in the ancient days, we had something called the Seattle-Denver Income Maintenance Experiment. It was in the 1970s and 80s. And what that experiment showed was that the marginal tax rates on the programs, it created different experimental programs. Marginal tax rate did not matter that much. What mattered was the core amount of benefits being given. How do you cut the Gordian knot here? The simplest thing is, when you are giving assistance to an able-bodied adult, you must require that adult to work, prepare for work, or look for work as a condition of receiving aid. That's what we did in the AFTC reform, but we only did it in one program, and that's why that reform was unsuccessful. That does not cost you more money. That costs you less money. That's the key to increasing employment.
Thank you, Mr. Rector.
Mr. Blumenauer.
Thank you, Mr. Chairman. I would agree with what Mr. Rector said about states being AWOL. I mean, the states historically have not stepped up. They could have, they didn't, but there's a whole range of areas. Pollution. We wouldn't have a Clean Water Act if states would have
stepped up and done it, and if they had had the capacity to deal with things that cross state lines. That's why, for instance, and I appreciate Mr. Haskins talking about some of the upside of what happened in '96 and some of the downside. The states loved the idea of block granting then, and you look at what's happened in some states. Texas is a classic example where they have backfilled a whole host of other things. The benefit levels in Texas are abysmal. Nobody in this room could remotely live on those levels, but they've used it for other purposes. And you've got material, all of you have got material, that the press has tracked some of this, where it hasn't gone to the neediest. It's gone instead to backfill problems that they couldn't solve in Arizona by selling their state capital. I'm not certain that that was the best policies to have followed, but we're dealing with some realities here. I am more than a little frustrated that we seem to have an inability to accept some of the successes. I mean, Richard Nixon, Daniel Patrick Moynihan wanted a guaranteed annual income. And we've started to move in some of the direction in '96 to move towards rewarding work. But at the same time, Congress in its wisdom has made these programs much more complex. Poor people have to navigate all sorts of conflicting standards for, we've tried to streamline it for food stamps. That's been a struggle. We make it hard for them. We have different standards for poverty if it's going to be for a college program under Pell Grants. It's what happens in terms of qualifying for some other educational benefits, for food stamps, for receiving money. They navigate something that would take the complaints we hear from business community about the complexity of rules and regulations. They're simple by comparison to what families which, and I again agree with Mr. Haskins, a lot of these people are marginally functional. And we have them go from pillar to post to try and deal with different standards for health care, for food stamps, for educational benefits. It's draining, it's exhausting, it's not efficient. It wastes money of the system and of their time. I think it would be better if we tried to take the programs that work, try and refine them, actually have some standards, but deal with the realities that these folks live in. I just chuckle with the notion Mr. Rector talks about. If you just even this out all across the board, it would be $36,000 for the 100 million poorest Americans. That's not how the system works. That's not how it's allocated. We're dealing with extraordinary, as my colleague Mr. Van Hollen pointed out, the bulk of this medical expense driven to the disabled, the elderly, the most vulnerable, and cost and expensive, and that's not going to change. I am hopeful that we can come back and be realistic about the needs, and before we start walking down the path of seriously entertaining more draconian activities, more block granting to states that will use it to backfill and not step up, for example, like Medicaid, the people that are visiting your offices are terrified that the Republican approach to Medicaid will be adopted, because they're getting hammered now, even though as Mr. Greenstein points out, it saves money, at least as opposed to private health insurance or Medicare. They're terrified about the cuts that are coming, and there is nobody that's going to step up and take it. One of the things I'm concerned about, and Mr. Haskins, while we have you here, part of the law of unintended consequences, didn't we see some rather interesting shift after 1996 to watching people move from welfare to disability? Have you looked at that at all?
Yes, there has been some movement like that, especially among children, and some people think it's not right, but advocates think it is. This is a very sensitive subject. We did change SSI for kids in the '96 legislation, and as a result of that, about 100,000, a little bit more than that, I think, lost their benefits because they weren't disabled. They had things like dyslexia. So the rolls went down, but then they came back up.
I see my time's
Thank you.
expired, Mr. Chairman, but that is one of the areas that I think would be kind of fun for us to focus in on, not for children, but for what's happened to disability payments altogether. That's been skyrocketing.
Yeah, Ways and Means, we've done some hearings on this as well. Mr. Stutzman.
Thank you, Mr. Chairman. Mr. Rector, I'd like to follow up on a comment that you had made, and I know what you're referencing to as states are coming to the federal government to ask for money for programs, but I come from Indiana and served in the state legislature there for 8 years, and I'm seeing a real shift there that the legislators for sure would like to see more authority and the ability to have authority over programs like Medicaid. Are you seeing that anywhere else across the country? Is there a shift that people are frustrated with the strings that Mr. Haskins referenced? We saw that with the stimulus package. We saw that with just about every federal government program. There's always strings attached to it. We even just avoided unemployment insurance money from the federal government because of the strings that were attached to it in Indiana.
I think Medicaid is different because, as I said in my testimony, 75% of means-tested spending is federal, 25% is state, but almost all that state spending is in Medicaid. And when you set Medicaid aside, this is like a 95% federally funded system, and it's important to realize that. States are serious about Medicaid because they have a lot of money on the table, okay? And it is absolutely true that what Obamacare does is it radically demands that states spend more money on Medicaid by increasing the enrollment. And it's not increased for disabled. It's increased for the disabled are already covered by that program. All these increases are going to able-bodied people, okay? And the reality is I think that the states do have a lot of play in the Medicaid system, and they need to have a very important role in determining how that system would work. By contrast, something like food stamps, they have only 10 cents on the dollar in play there. What actually happens with a program like that is it becomes bureaucratically autonomous when it hits the state. States will not be serious about work requirements, for example. They don't have any money in it. It's not their program, and they don't want it. You want to take this over? They will not take that program over. They don't want to spend their money on that. They want you to spend this federal money. But if you're going to spend federal money on a program like that, you have to make sure that that program meets the real goals, which should be to promote self-sufficiency. When Lyndon Johnson launched the war on poverty, he said he wanted to reduce dependence, not increase it. He wanted to make people prosperous and self-sufficient through their own abilities. And judged by those standards, this $19 trillion has been an absolute debacle. The poor are far, far less capable of self-sufficiency today than they were in 1964 when we started these programs, because these programs reward non-work, and they in particular reward non-marriage. The percentage of births out of wedlock has grown from 7% in 1964 to 42% today. That is the key cause of child poverty today, and it's a key factor in all this welfare spending.
Well, Mr. Mulligan, I'd like to ask you a question as well. In relation to the 70 programs, roughly 70 programs, which I'm not sure if that even includes earned income tax credit.
It does.
It does it? Okay. Or, how have you seen these programs affect the incentive to working for people? Because I can tell you, I hear from constituents back home that are very frustrated with folks who do take advantage of programs, and they say, you know, if they would work as hard at finding a job or getting out and finding work as they do at finding government programs, they'd be successful. And so I think that there's also this shift in our society that there are so many government programs out there. Go out and find it, and you can make a living off of it.
In the research field, we have a term called take-up. It refers to how many people who are technically eligible to receive the benefits from a program actually go and get the benefits. And the take-up in a lot of programs is less than 100%. There are a lot of people who choose not to take the benefits. And I account for that in my calculus. Now, I have not looked at the baseline of what happens if we had no safety net. My baseline has always been what happens if we go back to 2007. And if we go back to 2007, there would be a small percentage of people whose employment status would be different. Now, an economy with 300 million people, a small percentage, we're talking a couple million people would be affected, but it's still a small percentage, and the norm is to continue working and continue to be employed despite rule changes in the safety net programs.
Yeah, thank you. I'll yield back.
Thank you, Ms. McCollum.
Okay, there it goes. Thank you, Mr. Chair. Stereo though, so I just have one on. Thank you. Boy, after being here an hour and a half, there are so many questions and things that I'd like cleared up, but I'm going to have to focus here tight. One thing I would like to just say is to Mr. Garrett, the term unconstitutional versus not in the Constitution, directed in the Constitution, are two very, very, very different ideas, two very different concepts, because something's silent in the Constitution versus unconstitutional. And we're just kind of throwing those phrases around here, and the social studies teacher and me just had to take a second and go back and take out the dictionary, and we need to mean what we say and say what we mean here. I would like to go back and just really, let's look at this chart here. The people that we are talking about, seniors, our aunts or uncles, great aunts and uncles, if you're lucky enough like I am to have a great aunt who's made it to 104, never thought she'd live this long, lives independently. She's on, she receives Medicaid support and help. The disabled that I heard from when I was in the State House and we were going through and doing the welfare reform, who said, you know, I want to work, but when I work and I make a living wage, I lose my personal health care attendant. I can't afford that. I can't afford to lose my personal health care attendant. The mothers, through no fault of their own, found themselves all of a sudden with children, said, I don't have any health insurance if I go back to work. So some of the reforms that we made to Medicare to help the elderly, we also made to Medicaid to help people who had children who wanted to go back to work. And now we're saying, no, we're going to cut that. You're not going to have access to health insurance for your children. But I want to talk about SNAP for a minute, because I've been out visiting several schools in St. Paul. And I have to tell you, two of them that I've been to, 40–60% poverty in these grade schools. And I've been there in the morning, and this is the school lunch program, but SNAP is also what's keeping them fed at home. Their parents, after about 2 weeks, the food's done from SNAP, they're over to the food shelves. But these kids who come into the school lunch program, that on Monday might have been the first opportunity for them to have milk or a piece of fresh fruit. They are quiet, they say thank you, and then they have a healthy meal again at lunch. Because, you know, if kids are hungry, they can't concentrate in the classroom. And I know that this would not reflect any one of my colleagues here, but this is what's upsetting to me about the discussion and what I'm hearing about how people are talking about cutting SNAP and SNAP's not needed and, you know, food stamps are a waste. And I know this doesn't reflect any of my colleagues here or any of the people on the panel, but these are the things that are out there that people are talking about. Rush Limbaugh, children to eat, can't find food, there's always a neighborhood dumpster. June 16th, 2010, and I'll just cut to the end of it. It says there's things in your house. There's a thing called a refrigerator. You probably know about it. Try looking there. There's also things that are called in the kitchen in your house called cupboards. And in those cupboards, you might go to find a ding-dong, a Twinkie, potato chips. He goes on and on and on. And then he goes on and says, if that doesn't work, try a Happy Meal at McDonald's. You know where a McDonald's is. There's a dollar menu at McDonald's, and if they don't have Chicken McNuggets, dial 911 and ask for Obama. But here's what really, I think, goes to the heart of what, when we're talking about SNAP and those people. There's another place, Limbaugh goes on. If none of those options work to find food, there's always the neighborhood dumpster. Now, you might find some competition with homeless people there, but there are videos that have been produced to show you how to healthfully dine and how to dumpster dive and survive until school kicks back up in August. Can you imagine the benefit we would provide people? Folks, we need to, when we're having these discussions, not talk about those people or welfare people the way that we are. We're talking about Americans. We're talking about our children. We're talking about our elderly, who, by the way, access SNAP. And so just to this chart again, where we are today with where we talk about cutting entitlement programs, it's seniors, it's the disabled, and it's children.
Thank you, Mr. Stutzman. Excuse me, Mr. Langford.
Thanks, y'all, for being there. Here's a hard question for us as a nation to struggle with. We have people in great need, and we're a nation that has determined we're going to step up and help. We're going to provide a safety net. Now, how do we determine success of that safety net? Is it based on the percentage of people that are in poverty? Is it based on the transition of people that were once in the safety net out of the safety net? That they were there, we helped them successfully navigate out of that safety net? Is it the length of time in programs? Is it the coverage of every area of that individual? How do we determine success? So I have a lot of questions there. Just quick responses, what you have seen from anyone who'd like to respond to that. How do we determine success?
I would go back to Lyndon Johnson's original goal, that the success here is not to increase the number of people receiving handouts. He said, I don't want to deal merely with the symptom of poverty. I want to deal with the causes. I want to make people prosperous and self-sufficient. He said he wanted to turn the poor from being tax eaters into taxpayers. So one measure of success would be the percentage of the able-bodied population that's able to sustain itself above the poverty level without government handouts.
Okay.
And by that standard, absolute, unmitigated 40-year disaster.
Because that's the issue. We have this structure now. If that is a goal, and I would concur, that's a great option for the goal to say let's help people transition out of it. Are we accomplishing that? Because that's part of the issue here. Other comments you want to make? Yes, sir.
Well, there's no simple answer. There are multiple goals. Reducing need and great hardship. We don't expect people who are elderly or disabled to go and work, and I very much agree with Ron Haskins. The data is crystal clear. We all wish it weren't the case, but there is a group of families at the bottom who have physical problems, mental health problems, depression, little education, little cognitive skills. I don't know if I'd go so far as to use Ron's word incompetent, but these are people and for some of them, I think we could try subsidized employment programs in the private sector, but they have a very hard time holding a job on their own. In terms of transitioning off the safety net, well, yes, but. You know, here we have, I think the chairman would probably agree with what I'm about to say. I mean, if you really want to look at the safety net, you have to look at the tax code as well. I mean, we have $1 trillion of tax expenditures. We have people who get things all the way up. So it's complicated. One last point, though, that's key. Over the last several decades, we've effectively made a decision implicitly in this country that to compete internationally in the economy, we will let wages erode some at the bottom of the wage scale. And we provide things like the earned income credit. We let health insurance is eroding among employers, but we have broader health coverage. Surely I would presume most members, and perhaps all the Republican members, would agree that the right answer to lifting working poor out of poverty isn't to have the government set a minimum wage so high that alone, I mean, you'd probably lose jobs if you raised the minimum wage that high. So if you are in this international economy where wages are eroding at the bottom, you need a larger government role in making work pay and supplementing low wages, and you want to make sure...
Let me interrupt, because I do have a ton of questions we're not going to get to now, but I do want to make a couple of mentions of it. One is the comment that you made earlier, Mr. Rector, and that is, as we've seen marriages collapse, especially among the poor, we've seen a greater need for government to engage, and the safety net continues to grow. And it is my concern is that we have shaped a safety net in such a way that is created a disincentive for families to stay together, and that we have somehow, as we try to create this safety net, we've also created a system where families aren't needed financially in that. We need to have a system that doesn't punish or doesn't ignore the family, but also blesses the family in that. But I would also ask this question, areas of fraud that we experience, because there are areas of fraud that are out there. We need to have a good safety net, but we need to also be diligent to make sure that the people that are receiving benefits are the people that are exactly intended to receive those benefits as well. Comments about fraud, whether that be in SNAP or whether that be in SSI, I can't tell you the number of senior adults that catch me that are furious about fraud that they've seen or experienced around Medicare. Individuals that have come up to me that are receiving SNAP or that are receiving Medicaid, that once we probe it, you think, okay, this is probably not legal in how they're receiving it. Other things that you've seen or comments that anyone want to make about SNAP or any other programs, or how we deal with efficiencies, making sure the right people receive the right benefits.
There's a massive amount of fraud all the way through all of these programs. You have to have much greater controls on identity, particularly in Medicaid. One of the other things that you can do to reduce fraud, though, one of the key elements of fraud is people that are working and don't tell you that they're working, and they get benefits they're not entitled to. One way to get around that is to have a work requirement. If you say you have to come down here and do job search, and they already have a secret job they're not telling you about, they can't do both of those things. That was a major factor in the caseload reductions in the early TANF reform, that you were effectively rooting out fraud, caused substantial reductions in people that should never have been on that program.
Thank you, Ms. Bass.
Yes, thank you. Let me just follow up on some of what you were saying, because I do think that there has been a lot of fraud and misuse of benefits, but I think oftentimes, especially if you look at the dollar amount, a lot of that fraud, Medicare, if you look at who is committing that fraud, the dollar amount doesn't compare to the individuals versus some of the fraudulent businesses in the medical appliances and all. You can't really make that comparison. But using the example that you were just giving, though, in terms of somebody who was working and they hid the fact that they were working, you know, a lot of times people are caught in a catch-22, because one of the main reasons why women go on and off public assistance is because when their children get sick, if they don't have the type of job that allows them to take sick days, then they have to stay home with the children. They lose their jobs. So it's a real catch-22. If people had health care and if people had child care, that is one of the biggest incentives for people to be able to have their job and retain it. I wanted to ask a couple of questions. Mr. Haskins, you described people who were at the lowest income levels as being incompetent. And I was just wondering if you could maybe explain that a little more, what you know about this population, why you would describe them as incompetent, and where you would kind of go with that. I mean, you raised the question, you weren't exactly sure what to do with them. So maybe you could tell me how you've reached the conclusion about competency.
The first characteristic is an inability to hold down even a moderate job.
Right.
And I can tell you that research shows that families that have more than one problem that interferes with job, like 3 or more children, a disabled child or a child with some kind of even a mild disability, low education, a big one is depression. So families, low-income families, usually single mothers that have 2 or more of those problems, are much less likely to be able to stay in the workforce.
Right.
So that's what I mean. They have problems. It's not like they're lazy. They just are not competent to handle the problems that other people are able to get around. We all have those kind of problems. So that's what I meant.
Okay, and I appreciate you making the distinction between that and laziness, because actually some of those problems that you described, and I'm sure that you would agree, a person who is middle class can also have all of those same problems, or upper middle class. Right. But if you have support services around you and you can afford to purchase counseling or purchase, medication, then you don't typically fall through the cracks if you have those same type of problems. Is that?
I think there's some truth in that. If you want to learn more about this problem, there's a program in Chicago called Project Match. A woman named Toby Herr, who's been working on this problem, I think, for 20 years. And I think she would agree with the description that I just gave to you. And she finds that it's very difficult, even with intense help, to help these people get on their own 2 feet. She has a program called Small Steps. So what she does, for example, is to get the mother to come to the child care facility or Head Start facility and be there for, say, 10 hours a week. And then after she's done that for 6 months, to come more and to do something else, eventually to look for and get work. So it's a series of small steps. I think these problems that the low-income mothers have that I'm describing they're less able to handle them than other, even single mothers are.
Right, and so, and one of the reasons why I was asking you to explain, and I appreciate your explanation, is because how you would resolve those problems, what you've described are a number of programs. Now, what I'm concerned about, and again, I appreciate your description because, frankly, sometimes I'm saddened when I listen to some of my colleagues who describe people who are low income, because I think that they don't have a real view, or maybe they don't have the life exposure or the education to understand that people who are in the circumstances that you described, and you describe them as not being lazy, but you describe them as people who have a variety of circumstances that when multiplied have people fall through the cracks. So to me, then, I think about some of what we're proposing here would actually make the problems that you're describing worse, and also people who might have had a higher level of competency, education, skills, or whatever could actually be pushed down. So instead of strengthening the programs that you're describing, I'm concerned that what we're talking about doing would actually exacerbate the problem in the population that you just described.
Can I give a 30-second response to that, Mr. Chairman? Okay. These are exactly,
If I can respond
I
back.
agree with much of what you say, but this is exactly the kind of description that we had back in '96 when welfare reform was passed. People on welfare are not going to be able to support themselves. When we created a system that demanded they do so, imposed financial penalties on them, imposed time limits on them, no matter what your interpretation of their characteristics is,
Right.
they went to work.
Right. However, a
the
couple
key-
things,
the key
because
is to
I got to
have a
reclaim my
program.
time, because I'm going to run out of it. I got to respond to this, unless you're going to.
I'll give you 20 seconds because
Okay, then.
we got other members here and we got a vote coming up, so go.
That's fine, but
Yep.
go ahead. Go ahead. Who's
Oh,
it?
no,
Me?
I thought you wanted to say, okay.
Oh, yes,
Ms.
yes,
Black.
yes. No, I'm
I
sorry.
gave you
I
20
do.
seconds for you to respond.
Oh, okay, I'm sorry. I thought you were giving it to him. Let
No, to you.
me respond. I would agree with you. During that time, we were in a better economic situation, and what we provided was child care, and we also provided the ability for those folks to get training and education. Over the years, we've cut that back. We've cut the child care, we've cut the education, and I think that we all know, especially in this current recession, the homelessness amongst women and children has increased. Thank you.
Thank you, Ms. Black.
Thank you, Mr. Chairman. I am one of those people that really can be convinced that something is workable if you can show me the numbers that it is really managing the problem that you have. And when we look back at the initiation of these programs and we see 6% of the population at that point in time, and now we say 42% of the population is in poverty, something's not working. And for me, I want to know what is it that we can do to make it work, because if our real incentive here is, as President Johnson indicated, that we want to make people self-sufficient and prosperous, it doesn't appear that we're going that way if more people tend to be on the government, taking from the government because they are not able or not being self-sufficient. There's a real concern for me. And I will say that as a nurse and having worked with a number of people in the programs that I worked in, that what I saw was something very disturbing, is that people become trapped. And they become so dependent upon a system where even when they have the skills and you give them the opportunities and they attain the skills, that they are fearful that if they go to work or if they're not any longer getting that assistance that they have gotten regularly, that they may not be successful in the work world. So, I'm fearful now, I can't do this, I'm going to be trapped. And that is where I think that our mistake is being made, is that we have got so many people being trapped in this program and they're not getting out. So can any of you, and maybe I'll start with Mr. Haskins and Mr. Rector, talk about how we can do things to keep people from getting trapped in these programs?
Well, I hate to be a one-note Johnny here, but work is the key. We have to have strong work requirements. We have 2 work requirements in food stamp program that are observed in the breach. The states do not aggressively implement the program. The biggest savings, I think, is in unemployment insurance. I mean, what kind of system do we have where unemployment insurance, people that draw that, have a work history? Compared to welfare, we have very strong work requirements in welfare, but in an unemployment insurance system, we have a requirement in the law, but it's not observed. We should have much stronger requirements in unemployment insurance. People would get back to work much more quickly. Europe is supposed to be the land of entitlement, and they give money away to everybody. Several European countries, especially Germany and something called the Hartz reforms, has greatly strengthened their unemployment insurance programs and imposed much stronger requirements and even reduced benefits and reduced the length of benefits to get people back to work. This is the future of all the Western democracies. More people have to work. When they get unemployed, they have to go back to work sooner. That's what we have to do.
Would you agree, Mr. Rector?
Focus on two factors. If you look at the $450 billion of the welfare state that is families with children, overwhelmingly about 80% of that is single-parent families. Okay, so there are two causes of child poverty in the United States and two causes of welfare dependence, and those are the collapse of marriage and very low levels of work. Even in the hottest economic boom, the average poor parent has only about 600 hours of work during the year. If you were able to raise that to full-time work, you would drop the poverty rate in those families by about 60%. And this is not in a recession, but in the hottest economic boom. So as Ron said, you clearly have to get the work rate up. You have to do that by saying in programs like housing and food stamps, able-bodied people will work or at least look for work. But more importantly, that isn't really going to work if the marriage continues to collapse. The welfare state has driven fathers out of the home. That is the predominant cause of child poverty today. If a mother is married to the father, even if you hold education and race constant, it drops the probability of child poverty by 85%. There's nothing even remotely like that. Marriage is more effective, now get this, marriage is more effective in reducing child poverty than having the parent graduate from high school. I'm not saying, now there'll probably be a press report, oh, he doesn't want people to graduate from high school. Graduating from high school is really, really important, okay? But actually, amazingly, marriage is more important, and we treat it with absolute indifference, if not disdain, within the welfare system.
Well, thank you. And, Mr. Chairman, I think it's already said, my second question would have been about the incredible growth in the SSI program. And I know we've had some hearings in Ways and Means, but I would encourage that we would have those very hearings in here as well. Thank you. Yield back my time.
Thank you. Mrs. Bonamici.
Thank you, Mr. Chairman. So I noticed, Mr. Rector, in your testimony, you talk about some 79, I believe it is, means-tested programs that you describe as making up the federal welfare system, and then you have tables with attached to your written testimony that outline those programs. So I think it would be helpful if we run through just a couple of those so everyone has a clear picture when we hear reference to the means-tested programs you're describing as part of the federal welfare system. You include the refundable child care tax credit, refundable child tax credit, the Pell Grant, a Job Corps, AmeriCorps Vista, and Head Start. And I'm not sure that those programs in particular come to mind for most people when we talk about the federal welfare system, but I just want to take a moment and talk about Head Start. In October last year, there was a column in the New York Times by native Oregonian, Nicholas Kristof, and the column was titled Occupy the Classroom. And Mr. Kristof described the findings of one of his interview subjects, Professor David Deming of Harvard, who'd taken a look at Head Start outcomes. And here's what he wrote. The former Head Start participants are significantly less likely than siblings, so we're talking about the same socioeconomic group, to repeat grades, to be diagnosed with a learning disability, or to suffer the kind of poor health associated with poverty. Head Start alumni were more likely than their siblings to graduate from high school and attend college. So I want to ask Mr. Greenstein, this assertion seems to back up what you said about the long-term gains that these programs produce. Programs such as Head Start, such as the Pell Grant and Job Corps, seem to be the kind of things that we would want to invest in if we truly have an interest in breaking the cycle of poverty. So I'm sort of setting aside that these programs are the right thing to do to help those in need. Let's just look at the economic sense. And these investments make long-term economic sense, do they not?
Well, I agree. You have to look at each program one by one, but if you take something like Pell Grants, in the absence of Pell Grants, fewer promising low-income students would be able to afford to go to college, and the data is very clear that while there are many factors, that people who graduate from college have higher earnings and better employment prospects than people who don't. With regard to Head Start, it's interesting. For a while, there were a lot of data that showed gains for children in the years following Head Start, but that then when you did standardized test scores, the gains seemed to fade away in secondary school. There's now new research that is very challenging that finds that even though some of the gains, or many of the gains, fade away in secondary school, they actually are finding that by the time people get to adulthood, that there are some increases in earnings. So I think these things are very important. And I'm also in agreement with Ron Haskins that for the people at the very bottom, we really need to do more demonstration projects to find the things that are most effective in helping them and then replicate them. One last point, and this is really key. Some of the most important emerging research is research that finds that for young children, that a difference of several $1,000s in their income, whether it is from earnings or from government assistance, is associated with increases in employment and earnings in adulthood. There is starting to be some evidence that it is deleterious for children's long-term earnings prospects to grow up in deep poverty, and we also need to take that into account.
Thank you so much. And just briefly, I wanted to talk also about SNAP. Because in 2010, there were approximately 27,000 households in my district receiving SNAP benefits. And when we talk about the programs and the people who rely on them, sometimes certain assumptions are made. So I just want to make clear about the data here. Of those 27,000 households in my district, the median income was below $19,000 a year. 50% of the families had at least one person working in the previous year, and 36% had two or more people working in the previous 12 months. So roughly 87% of the participating families in my district had somebody working. So it is our struggling working families who really need this help. These are programs we should be supporting and not cutting. And I yield back the remainder of my time. Thank you, Mr. Chairman.
Thank you. Mr. Flores.
Thank you, Mr. Chairman. This has been a fascinating hearing, and it really exposes the deep differences in the way we look at economic opportunity in this country. I'd start by saying let's remember that the best social program ever designed by man to combat poverty is a private sector paycheck. This is where you house a family, you feed a family, you educate a family, you grow a state and local tax base, and you grow an economically secure middle class. This hearing is about a choice between two futures for this country, a choice of debt, doubt, and decline versus a choice of restoration of American exceptionalism. It is a choice between a failed Washington solutions versus Main Street solutions. It's a choice between the reallocation of a shrinking economic pie versus a growing economic pie that provides more opportunity for everyone. It's a choice between a president's budget, which accelerates our bankruptcy, which no member of the Congress voted for, including the ranking member that waxes so positively about it, versus a budget that grows our economy and protects our security. It's a choice between no Senate budget versus a realistic House budget. It's a choice between food stamps or paychecks. It's a choice between more government versus more private sector. It's a choice between Solyndra versus Keystone. It's a choice between fake energy versus real energy. A choice between expensive gasoline versus abundant energy. It's a choice between tax increases versus tax reform. It's a choice between more poverty or more jobs. It's a choice between hiring more IRS agents and more EPA regulators, but having fewer troops and less security versus more private sector jobs and greater national security. For example, for the cost of a typical EPA bureaucrat, we could say we can pay and equip 2 enlisted persons in our military. It's a choice between more million-dollar vacations and spring break trips for our first family or more vacations for American workers. It's a choice between more wars against stay-at-home moms versus better job opportunities and bigger paychecks for spouses that work outside the home. It's a choice between more Fast and Furious guns for drug lords or more protection for American Second Amendment rights. It's a choice between more spending in debt or a balanced budget amendment. It's a choice between more spending on GSA bureaucrat parties versus more economic certainty and opportunities for middle-class Americans. It's a choice between more taxes on job creators versus more versus more jobs from those same job creators. It's a choice between more unemployment versus more employment. In summary, it's a choice between more debt out in decline for future generations versus a restoration of American promise, prosperity, and security for our children and grandchildren. In this regard, I have a question for Mr. Rector. What is the single biggest determinant of poverty among families? I think you've talked about it, but what is the single biggest determinant?
Single strongest determinant of child poverty is the absence of an employed father from the home. And basically, as we've seen, the non-marital birth rate rise from 7% to 42%. That has caused a massive rate of poverty as well as need for assistance. And it's just amazing that in any academic setting, every liberal and conservative in the room would agree about this, but once you come out in public, oh, well, we're not going to talk about this. Senator Moynihan talked about this almost 40 years ago, and this is the key factor. This is the key cause of poverty, and it leads to all sorts of problems for those kids. And if I were to say there was one thing that the TANF reform failed in 1996, was the goal of that reform was to at least hold the line and not allow further erosion of the family, and that did not happen. Things got worse.
Let me ask you this. Does anything that's been proposed improve the outcome of that single biggest determinant?
I think that we really have made very few efforts in this, but what I would say is recognizing that if the research shows that these single mothers who are predominantly very low educated, the least educated women in our society, are not hostile to marriage. In fact, they idealize it. They believe it's a wonderful thing, the way you and I might think about a trip to Paris, okay? And they also, they're very serious about being moms. They want a baby to have something to play with. They want to be a successful mom. The first and foremost thing we could do to help those mothers is before they have children, and these are women, these are adult women, these are not teenagers, but to say to them from a very early age, you want to have children, you don't want your children to be poor. Do you understand that the number one factor in reducing poverty among children is to be married?
Thank you,
Because
Mr.
no
Rector.
one tells them that.
Mr. Chairman, I yield back.
Ms. Moore.
Thank you so much, Mr. Chairman. It is so hard to prepare good, copious talking points because I'm too busy listening to what people say, and I have to respond to it. First of all, I want to associate myself with the comments of the chairman early on when he said, let's put aside the outrageous rhetoric. I agree with that. Let's start out with the rhetoric about the wildly successful TANF program. And oh, by the way, hello, Mr. Greenstein. Hello, Ron Haskins. These are good friends of mine. We've known each other since welfare was ended. Can you put this chart up? The first one I want is the child poverty rates and the loss of benefits. This is a real straightforward chart that shows that as benefits have gone down, child poverty has gone up. You don't have to graduate from the Wharton School of Economics to understand this chart. And rather than adopt, my good friend Joe Wilson for South Carolina's rhetoric, I'll just invite you to look at that chart. I'm so glad that in the past week I've watched my favorite reality program, these news programs, and our candidates, the candidate for president has talked about how, being a stay-home mom is work. I'm glad that we realize that taking care of children is work. I have 3 children, and trust me, it was work. They're all grown. They're still work. So here we're hearing about how women who receive TANF are not working. You can't have it both ways. And that they must go out in the workforce, and work is especially, parenting is especially hard if your maid doesn't show up or your nanny doesn't show up on a particular day. And it's really hard when you are the nanny and you are the maid for somebody else's kids. And if you don't show up for work, you get sanctioned under TANF. Not only do you get sanctioned under TANF, but you're deemed to be lazy. So that's the first myth that I want to put up. And you can also put up that second chart, which shows that we've got, put up the second chart for me that you had up first. Okay. The second wild, outrageous rhetoric I'd like to put aside is, I'm sorry, this methodology that we have from you, sir, Mr. Rector. I'll be 61 tomorrow, and I did have inferior education all my life, coming from the ghetto and all that. But I did go to college under one of the welfare programs, Pell Grants, and I turned in a paper, where you just sort of lump together all kinds of numbers, benefits that are given to on a community-based level, say AIDS stuff or community development block grants, stuff that wasn't given to individuals, lump them all together and then claim that you get given people 13,000. I couldn't keep up with these growing numbers that you had that were giving all these people. And they gave me my paper back. They told me, no, Gwendolyn, you cannot do that. Use that kind of methodology. So I would venture to risk, knowing that you are a genius, that I reject your methodology of determining that poor people are indeed receiving all these benefits. You just can't deem some 86-year-old woman that's laying up in the ICU, spending thousands of dollars a day in the ICU, and deem that income to a 2-year-old and say that they're not in poverty. I guess I want Mr. Greenstein to really respond to this.
Well, I very much agree with that. As Mr. Rector acknowledged, half or more of all the dollars in his chart is health care. That isn't money that goes to a family that spend. It's money that goes to hospitals, doctors, labs, nursing homes.
Goes to elderly.
2/3 of all Medicaid goes to elderly. I also agree with you that it's pretty difficult to take programs like the Community Development Block Grant, some of which goes to developers, it depends on the budget, and to act as though the CDBG dollars are the equivalent of purchasing power for low-income people. But the biggest issue regards health care, and it's consistent with what I said earlier and what I think Congressman Van Hollen said in his remarks. There are specific particular issues with health care, and we need to look at them somewhat separately than we look
Reclaiming
at
my
the rest.
time, sir. I was so happy to hear, Mr. Chairman, indulge me. I was so happy to hear that women are revered in this campaign and in this budget. I just want to point out that 2/3 of the SNAP benefits and 2/3 of the Medicaid benefits go to women. And if any of you guys know a man who wants to marry me so that I don't need Medicare, bring him on. I mean, I'm single. I'm open.
Gwen, we got some mutual friends in Milwaukee. We'll talk later.
Okay, I'm serious.
Mr. Akita.
Thank you, Mr. Chairman. I wanted to give Mr. Rector some time to respond, not to the marriage proposal, but to the other things that were said.
Well, I think those are all interesting and valid points. As I laid out, when you look at this total expenditure, about half of it is medical care. I made that very clear. About 10% of it is what I called enabling functions. Now, that's money. It's about $100 billion a year we're spending on behalf of the poor. We're putting that money out the door. For some analysis, you want to take that off the table. For some analysis, if you're trying to describe the resources that are going in, it's kind of important. But 40% of this is cash, food, and housing. And the simple fact is that just in cash, food, and housing alone, we're spending twice the amount of money needed to raise every single person out of poverty in the United States. Even if you took all the enabling programs off the table, took all the Medicaid expenditures for people in nursing home, take that off the table, you still have enough money left over, if you converted this into cash, to take every family in the United States to 200% of the poverty level, $44,000 a year. No Head Start, no job training, no nursing home care, $44,000 a year. It's an enormous amount of money, and no one knows where this money goes.
Let me go into that. Thank you, Mr. Rector. That was one of the questions that I had for you. You asked, and rightfully so, for a need for an honest accounting. Is there a specific proposal out there that you endorse, a system or process or procedure that would get us down this road to accomplish your request?
I think you actually have to change the way the census works. The census has undercounted income dramatically since 1950. It undercounts all types of income. The only thing it counts accurately is earnings. You know why it counts earnings accurately? Because it fixes the numbers. It adjusts them behind the scenes so they match up. Everything else is substantially undercounted, and then for the most part, all the non-cash assistance, which is now the bulk of assistance here, is just off the table. So what you have here is you have close to $1 trillion in spending. And when the census goes to count resources available to the poor in the most normal numbers, they count 4% of that. And then people come back and say, oh my gosh, the poor people have no resources. They don't have any resources because it was all hidden. It's all not counted. Again, the game here is you spend, then we in social science don't count it.
I understood that from your. Thank you. I understood that from your testimony. I just wanted you to get as specific as possible in a procedure.
I think that you need, first of all, to ensure that all things about resources of the poor have to include all the resources, including the non-cash. Don't talk about cash only. Secondly, I think you need a completely improved census system that begins to use non-survey data, looks at tax records and things like that, looks at welfare receipt and things like that, gets to be accurate. The census is missing $2 trillion in income each year. That's more than the gross national product of England, I believe.
Thank you.
It's very inaccurate.
Mr. Mulligan, do you have a response to that? Anything to add to that, to my question about how do you get to an honest accounting and from a procedural perspective? Just if you don't, that's fine.
The accounting area is really beyond my expertise.
Thank you. Mr. Haskins, same question.
Yes, I don't think the accounts are that bad the way they are now. The official Census Bureau measure is hopelessly flawed. The Census Bureau has a new measure they've been working on for a long time. It also has flaws, but it's much better because it counts all the resources. It does count the food stamps and so forth. And it may undercount them some. Robert is right about that. But we also are able, a guy named Burkhauser, Professor Burkhauser at Cornell, is able to include all those government benefits, including health care, and apply it to the income distribution and show that, unlike what you're likely to read in the New York Times, that the income of all 5 quintiles since 1979 has increased. And it's increased substantially because of government benefits, especially at the bottom. So government is already doing a tremendous amount, and I think we could reduce what the government does and still do a lot to equalize incomes across, not equalize, but bring the bottom up a little.
Thank you. And Mr. Greenstein, same question. Did you have anything to add?
Yes, we have a CBO series. It currently goes through 2007. It adjusts and it counts these other benefits. And I want to note that the figures I've presented in my testimony today give a full accounting. How do I do that? Like in my figures on 650,000 more kids below half the poverty line, I count non-cash benefits, not health care. I count the other non-cash benefits, and Robert's correct that the census undercounts. The Urban Institute and what's called the TRIM model fully adjusts. We adjusted using the TRIM model. We added in all of the additional benefits to get to the full amount that goes out the door and is shown in the federal budget. And it was after we counted non-cash benefits and fully adjusted that we find an increase between 95 and 2005 of 650,000 kids below half the poverty line. There are ways that are available to analysts, right, left, or center,
Thank you, Mr.
to
Chairman.
adjust.
My time's expired. I thank all the witnesses.
Mr. Ryan.
Thank you, Mr. Chairman. This has been a pretty interesting debate and discussion, so thank you for all the various viewpoints here. I think part of this, too, I think we need to look at the issue of poverty in context. And I don't think it even breaks down to some of these specific programs that we're talking about. And I agree that obviously the family is the #1 indicator, and not just single-parent homes. I come from a single-parent home, but there were grandparents and family members that are around, so there are alternative ways to try to deal with those situations. But the issue of context, and I think part of it is our education system. I think this drive to say that it's only about math and science, and it's not about the other skills that you actually need to live a full life in the United States of America, aren't being addressed, the social and emotional skills and having a level of emotional intelligence. It seems to me, it doesn't seem what job you end up at. It's about 10% of knowledge, of actual content. And the other 90% is how you show up. You're on time. You know how to deal with other people. You know how to connect to other people. And I think that this test-driven mentality that we have in the country has been a disservice to most of us, including and especially these young kids who are living in poverty. Because those first set of skills that they need, and this is a bit off message for what this debate is supposed to be about, those essential skills that they need aren't being taught to them in the schools. And they come from broken homes. But we're not talking about managing poverty. I think everybody here is about ending it and figuring out a way to end it. Part of the discussion, too, I think saying, we want to move people from tax eaters to taxpayers is part of this, but that doesn't reflect the fact of the matter that 50% of this is Medicaid, and while it may not be a cut in the definition of the chairman, it certainly is a cut if health care costs continue to rise, and those costs are going to be pushed off on to somebody. And those people are in Ohio and Wisconsin and Maryland and Florida that end up in a nursing home. That's who uses Medicaid in Ohio. Those are middle-class people that maybe making $44,000 a year that can't afford to have their, send someone to a nursing home without, but for the Medicaid program. It's about the issue of violence in our society and in those neighborhoods that those kids come from, and beefing up cops programs so that we have enough cops on the beat because the tax base has been eviscerated in some of these communities. You can't learn if you live in a violent, abusive neighborhood. Period, dot, the brain science is in. You can't learn. Your amygdala destroys your brain, and your prefrontal cortex doesn't work. So we've got to provide safe environments in our schools and in our neighborhoods. And we've got to invest in after-school programs. So these kids who don't have a father, who live in violent neighborhoods, have a place to go so they can learn the skills of teamwork and problem solving and all these things that we want to teach. So I think this whole thing has to be taken in the context. And I would argue, as well as probably most people on our side of the aisle, is that the Affordable Care Act helped address a lot of these problems. I mean, you talked about disincentives to go to work. Well, the Affordable Care Act incentivized work because you would be able to go to work and get health care. So there wasn't this choice for the single mom to have to say, I got to quit my job so I can get on Medicaid and stay home with my kid and go on the dole. Nobody wants to do that, and the Affordable Care Act incentivized that. It also provided incentives so that we can actually deal with people who are costing us a lot of money with the medical home and the accountable care organizations, so that we have these wraparound services that will drive health care costs down. At Summa Health Care System in Akron, Ohio, they're already saving $8, $9, $10 million a year by making sure that people don't end up in the emergency room. They end up getting the preventative medicine that they need. And I think the Affordable Care Act has done a good and will continue to do a good job. Lastly, talk about having to go and check in so you don't have an underground economy job. You got to go and check in at Department of Job and Family Services. Well, there are cuts in almost all the states now in programs like that. They're downsizing, and there's more people trying to access. So we've got to say, if we want to end poverty, we maybe have to make these investments into the workforce that's going to have to manage these programs. And then lastly, I really do wish a lot of my friends on the other side were as concerned about fraud in the tax system as they were about fraud among poor people in our society. And Mr. Flores mentioned it. The president is trying to beef up the Internal Revenue Service so that we can actually go after these folks, and there's not support on the other side. So it seems to me we're having a whole hearing on fraud from our friends on welfare state, but when we talk about fraud in the IRS, there's no hearings or
Thank you.
beefing up the IRS agents. So
Thank you. Mr. Huelskamp.
Thank you, Mr. Chairman. I appreciate the opportunity to ask questions from our experts here today, and come from the state of Kansas, and actually last fall our State Department deals with these programs, did I don't think it was a comprehensive review anyway, but a pretty superficial initial starter review, and found, at least in our small state, as much as $30 million in fraud in many of these programs. And you know, some of the typical cases, folks that aren't who they say they are, 6,400 that were probably from out of state because of our generous welfare policies in Kansas, 312 folks possibly dead and still receiving benefits. Somehow somebody was picking up that check, but that's just a small state. By my calculations, if every state undertook a similar review, they could save at least $3 to $4 billion annually, which is kind of what we're talking about in some of these farm bill discussions. Serve on the Agriculture Committee as well. My question is, was for the state of Kansas or any other state, what particular incentives do we have in the system to actually ask our state partners to actually help root out the fraud and abuse that we hear over and over is occurring right in our state of Kansas? Mr. Rector, if you would like to start.
Unfortunately, not very much. Again, part of the reason that TANF reform was taken seriously was that the states had money on the table in TANF. In a lot of these other programs, SSI, food stamps, they have very little money on the table. And therefore, it's very difficult to get state legislators or governors to pay attention to them. They certainly don't have any incentive to put effort into, say, cleaning up food stamp fraud because they don't pay for it. And I think that's very important to understand. Is you're going to clean that fraud up, it would have to be done by the people who pay for it, which happen to be you right here.
Yeah, actually, I serve in the state legislature, and actually the incentive is probably the other way around.
Yes.
If you don't catch the fraud, or actually on the Medicaid program, the more the state spends, at least in our state of Kansas, the feds will put even more in.
Yeah.
The debate over and over on the state floor as well. If we spend 40 cents, they'll automatically get another 60 cents, whether it's for fraud or otherwise. Right. And of course, we spend billions at the federal level trying to force fraud prevention units to work on the Medicaid and the Medicare side as well. But specifically, we have a farm bill discussion hopefully coming up this year. We'll hopefully make some real changes. But I want to ask each one of you, what could we do at the state level that would encourage our state partners, and they are partner in these programs. We expect them to serve as partners and actually to find a way to root out fraud and abuse and actually help improve a program to get the funds. We spend billions, as they do a great job outlining, to actually get to the people that are in need. And I guess I'll start with Mr. Haskins, if you'd like to answer.
I think there is already considerable motivation for states. They pay for almost half of Medicaid. They pay for half of TANF. They pay for half of the child protection programs. So they could save considerable money, and they administer all these programs, and they pay at least half the administrative costs of the programs. So they already have money in the game. Now, truly, it's correct that food stamps is the one that would be least likely to be vigilant about because the benefits.
But what on food stamps, though? I mean, that's within our jurisdiction on this farm bill that's coming up. So what can they do on food stamps? Are we going to just wait on Washington, or what can they? So a quick question on that, just on the food stamps that we're talking about here.
I think the key in food stamps is to turn it into a work activation grant, not a block grant, which is just we give you money, you do what you want, but a grant, a program that's designed to promote work and marriage, that requires states to have certain goals in terms of participation. It has some penalties and rewards if you don't, and has some serious things like fraud reduction. That's what really has to be done. I mean, this program is basically a dinosaur. It hasn't changed for 40 years. It's the same old giveaway program it always was. It doesn't serve, I mean, it certainly meets needs. I don't want to suggest that people aren't getting this money and aren't getting benefits from it. But in terms of promoting self-sufficiency and upward progress, it's not good at all, and we need to change it.
Exactly the opposite is true. I think I know a little about this. I used to run the food stamp program for the federal government in '79 and '80. I was credited with cutting the error and fraud rate more than in half and was celebrated by an inspector general who was one of those junkyard dogs Ronald Reagan promoted when he became president. The food stamp program today has only a 3% overpayment rate. Fraud is a part of that. That's 1/5 the rate in the Internal Revenue Code. States do have incentives. They come from several forms. States are required, as a condition of getting federal funding under food stamps, to do a very thorough, it's about 8 to 12 hours per case investigation. There are 50,000 cases done nationally. There's a statistically valid sample for each state. If the state's error rate is high, they're required to take corrective action. The federal government can and on occasion does withhold a portion of the federal share of state administrative costs if they don't act. And we've gone over several decades from a program that had a 17% error rate when I first came in to 3% today, and the 3%, I think, 3% overpayment, 2% net of underpayments. There's more that can be done, but one should not think that everything is a failure. I think in terms of error and fraud reduction in food stamps, we've made great progress. We have further to go, but we have made very substantial progress.
Thank you,
Mr.
Ms.
Chairman, I appreciate that time.
Thank you,
Go
Ms.
back.
Capter.
Thank you. I want to thank Chairman Ryan and Ranking Member Van Hollen for holding a hearing this morning on something very important. I view feeding the hungry, as do the majority of people I represent, as both a moral as well as civil imperative. I have a problem with the Republican proposal, however, and I'm glad for the hearing, because I frankly cannot support a budget that expands tax preferences for the most wealthy by nearly $1 trillion, $961 billion, while cutting the Supplemental Nutrition Assistance Program, our major food program, by $122 billion. For me, it fails on a moral level as well as a civil level. I'm sorry Congressman Garrett isn't here. He talked about the Constitution. Well, I think feeding the hungry is a constitutional imperative. We talk about forming a more perfect union, about assuring domestic tranquility, about promoting the general welfare and securing the blessings of life for our current population and future population. It seems to me this is central to our Constitution. The tax preferences that are in the proposed budget outweigh the food cuts by 8 to 1, 8 times more benefit to the wealthy than what is proposed here in terms of the $122 billion cut in supplemental nutrition assistance. It's simply it's a non-starter for me. And we know that 2/3 of these are people in our country who are gravely struggling. I can take you to a neighborhood in Toledo where we're installing community gardens and where women over the age of 85 go and pick every pepper that we raise in the summertime to the ground because of hunger needs. And there isn't a single food bank in the region that I represent that isn't strapped to the edge. So I think to propose cuts $122 billion is absolutely unconscionable. Now, I asked the staff to put up this chart because I was sitting here working on some numbers. These are raw figures. They show the number of people in poverty in different years and decades and the number on SNAP. Well, when I sat here and figured out per million population, if you go back to 1990 and you look at how many people were on SNAP when we had 248 million people in the United States, it was about 8% of the population was registered for our food programs. You know what it is today with a population of 310 million? About 7%. And so it's actually not gone up, and it's actually gone down as a percent of our people, despite everything that is happening. So this chart needs another line, and that is to talk about the relationship to our population as a whole. So I think we're doing extraordinarily well as a country. And also, if you look at the red line at the top, you'll see when Republicans were in power, Mr. Flores talked about jobs. More people went into poverty because jobs were outsourced. Jobs were not being created. Those who had wealth took it someplace else, and they did not invest here. So you look at the Bush era after the late 80s, early 90s, and when Clinton became president, what happened? Poverty started to go down. And then what happened when Bush got in there? Back up again in the early 2000s. I mean, and then we had the horrible crash in 2008, under Bush's watch. Look what happened. We're still trying to dig out of that. So I think that we have to be reasonable in putting these budgets together and do what our people would want us to do, and that is to take care of those, including many members of our military who are eligible for food stamps because they're not paid enough. And for those who are working, who can possibly work in a laundromat, a mother with children at minimum wage, owning a clunker of a car, having to pay gas to get to work, pay the heat bill, live on $1,300 a month? Almost an impossibility in our country. So I wanted to ask Mr. Greenstein your thoughts on the SNAP program, most of the money in SNAP, and I am a member of the Subcommittee on Agriculture, goes right into benefits. It's a very efficient program. Isn't the program being run efficiently something that we should be proud of and not be cutting at a time of need in our country when there aren't enough jobs being created because so many of our so-called corporations decide to go abroad where there are no labor rights, there are no environmental standards, and people live as bonded labor in so many of these countries? Isn't it an efficient program? We should be proud of this program, maintain it, and not cut it by $122 billion?
Yes, I think it's one of the most efficient and best-run programs we have. There's been a lot of discussion by the chairman, among others, of the big increases in SNAP costs in recent years. When you look at what happened following the '96 welfare law, in an unintended side effect, a lot of people that left welfare for work got cut off food stamps when they went to work for low wages. It wasn't intended. Ron Haskins was among those who testified that we should address that. You shouldn't lose food stamps if you went to work for low wages. Congress, on a bipartisan basis, Clinton and particularly the Bush administrations made the program more accessible to the working poor. We went from about 70% of eligibles getting benefits in '95 down to about 50% at the start of, Chairman, your 10-year period. It's back up to 72%. The three major reasons food stamp costs have grown are the downturn in the economy, the increase, which will expire in under era, and the significant increase since 10 years ago in the percentage of eligibles that get benefits concentrated among the working poor. We went in the last 10 years from 43% of eligible low-income working families getting food stamps to 60%. And I don't know, I had in my testimony, it's somewhere in the slides, if you look at food stamp costs since 1995 as a share of GDP, they're way up now, but under the CBO forecast, by the end of the decade, they come all the way back down and then go below the '95 level as a share of GDP.
May I just interrupt and say, Mr. Chairman, the cost of food has gone up so much. In Ohio, to buy 2 lamb chops, which I don't buy, $10.62. Now, who can afford that in the supermarket? All right? So the cost of food was not included in these charts either. Mr. Chairman, I just want to ask for the record, if any of the panelists could submit for the record how many people in the state of Ohio in each of the following categories would become increasingly food insecure if the $122 billion cut were adopted: children, seniors, the severely disabled, the unemployed, and families who are working. Does anybody have those figures?
I don't think they do. Time's expired. Ms. Wasserman-Schultz.
Here. Thank you, Mr. Chairman. You know, it's been interesting to sit through this ironically titled hearing, Strengthening the Safety Net, when the Ryan budget does just the opposite, because it achieves most of its savings by pulling the safety net out from under the most vulnerable. With that preface, Mr. Greenstein, could you help with some data? What % of the Ryan budget cuts, in your analysis, come from programs that serve low-income Americans? And then also, could you talk about your broader analysis of the impact that the Ryan budget has in general, and what were your main findings?
So there are $5.3 trillion in expenditure reductions, not counting interest savings, over the next 10 years. Our analysis, and it's conservative, the figure's probably too low, is that at least about 62% of that would come from low-income programs. The way we got that was for all the programs where there are specific figures, Medicaid, food stamps, and the like, including the specific figures. For the areas where there weren't, non-defense discretionary and entitlement programs other than like Social Security, Medicare, and so forth, for which there isn't a specific number, we simply assumed that the percentage reduction in that part of the budget, that you'd have the same percentage reduction in the low-income component. If you take discretionary, since I don't think there are going to be those kinds of reductions in veterans' health or the FBI or things of that sort, the odds are that the low-income reductions would be bigger, but we didn't assume that. And the figure ended up being 62%, or $3.3 trillion of the $5.3 trillion in budget cuts.
And just more specifically about SNAP caseloads, because obviously during the Great Recession and its aftermath, SNAP caseloads grew, because making sure that people were not food deprived was incredibly important. But as the economy recovers, and we've had many more people who, in order to make ends meet, are dependent upon SNAP, can you talk about what we can expect would happen to SNAP caseloads as the economy improves?
So I've been following the SNAP program since 1972, and the caseloads go up in every recession a lot. And in every recession, there's a lot of commentary that they'll never come back down after the economy recovers. And after every recession, they do come back down. And that's the CBO forecast, and I think that of most analysts. Over 90% of the funding in food stamps is right for benefits. And the remaining, a little short of 10%, is to make sure people are eligible, to make sure the retailers are complying with the program, and to administer work requirements, which the program does have, and the employment and training program. It's pretty hard to get much savings there. So if you had to take $133 billion out of the program, which the budget does, you have to cut benefits. You have to cut eligibility, benefits, or both. It's unclear which states would do, but perhaps a combination. But there's little question that you'd have some numbers of millions of people who would no longer be able to get food stamps. And for those who did, most likely, they would get smaller amounts, which is a concern, given the evidence that people do run out of food before the end of the month. The Institute of Medicine is currently conducting a study of whether the level of benefits in SNAP is adequate. I don't know where they'll come up, but enough questions have been raised in the research that they thought it warranted a study. I think the results will come out the end of the year.
Having gone through an exercise myself on trying to subsist on what it would be like if I were on a food stamp budget, I can attest to it being extremely difficult, if not impossible. Just lastly, as recently as 2008 and 2009 in my home state of Florida, nearly 350,000 families with children were living in poverty. Can you talk about the impact in their time I have remaining of what that would mean for those families if we change the SNAP program, the food stamp program, from a safety net program into a block grant program?
Well, the effect would be by far the most severe during economic downturns. The food stamp program automatically responds in recessions, block grants don't. In addition to...
And that is because a block grant, you're giving a finite amount of money, you're saying this is what you have, do with it what you will.
Well, under the TANF block grant, there's no adjustment even for inflation. And the total amount of federal money in the program is lower in nominal terms today than it was when the program started because of the elimination of the supplemental grants. I don't know what the specifics would be in food stamps, but based on prior proposals, maybe it would adjust for inflation, maybe it wouldn't. But that doesn't necessarily take into account population growth. It certainly doesn't take into account downturns in the recession. And block grants do very badly in adjusting for changes in need across states. Not all state economies, poverty rates, and so forth move at the same rate. My particular concern is about the people both Ron Haskins and I have been talking about on this panel at the very bottom, the people who have difficulty holding a job, the people who are worse off as a result of the welfare law, recognizing other people are better off. In 1995, my distinct recollection is that when the Ways and Means Committee marked up the welfare law, Democrats on the committee said this is going to harm poor children, and leading Republicans on the committee said we are maintaining food stamps as a floor, no children will be hungry. The fact that TANF is a block grant actually, in my view, makes it all the more important that food stamps retain its entitlement structure and be that floor under the poorest families.
Thank you very much. Thank you, Mr. Chairman.
I'll just, in closing, make a couple points of clarification. There's a lot to talk about spending cuts. The budget we passed increases federal spending from $3.6 trillion a year to about $4.9 trillion a year over the 10-year period, instead of the $5.8 trillion, which is what the president proposes. So we're talking about rates of increase here, not even talking about actual cuts. With respect to how to structure block grants to, say, programs like SNAP, when your formula, as ours proposes, is population, eligible population plus inflation, then if the eligible population increases because of a recession, then the formula reflects that. So you can measure for these things, account for these things in your block grant formula, so long as you write your block grant formula appropriately, and that's what we're proposing. But Mr. Van Hollen, I want to yield to you. You have a UC you want to ask for?
Thank you, Mr. Chairman. First of all, I want to thank all the witnesses for their testimony. I do, Mr. Chairman, think going forward we should keep in mind this distinction between means-tested health programs and other programs. I think as we've seen, the overwhelming amount of funds are in the health programs and the growth is in those programs, and I don't think that the Welfare Reform Act work incentives apply many lessons to there, as we've heard today. I would ask you, Mr. Chairman, for unanimous consent to submit for the record a report from the St. Camillus Food Pantry in Silver Spring, Maryland, a food pantry in my community that serves over 6,000 families on the issue of food security.
Without objection. Gentlemen, thank you very much for spending your morning and into the afternoon with us. We appreciate your time traveling out from Chicago. Dr. Mulligan and everyone else, this hearing's adjourned.